Good morning, everybody. Welcome to our May Trust Board meeting. Lovely to see everybody this morning, virtually again, of course, and lovely to also welcome those who are joining us virtually on the the live link of the board meeting, and including our new chair designate, Caroline Flint. And on behalf of the board, I'd like to extend my own and the board's congratulations to Caroline for her appointment. Caroline will be taking up the post in September. And in the meantime, Michelle, I and the board are working closely with Caroline to ensure a really smooth and really good handover. So welcome this morning, Caroline. Delighted to have Mr. Smith, Mike Smith, back with us. And for non-execs, I really should say back in the saddle or some other horse a little quip, but delighted to have you back with us, Mike, this morning. So that's really good. I don't think we've got any apologies, Jess. So if board members don't mind, if we could go straight to our staff story this meeting, which is actually item 5, rather than keeping Katie waiting. So Katie, over to you.
Thank you. Good morning, everybody. So today's staff story is around the leadership development programs that we have. It's going to be in video form, and so I'm going to try and share my screen, share my audio, and share the video with you. So fingers crossed. I've only got one screen to date, so I'm having to do it a little bit differently, but bear with me. There we go. Now, hopefully you can all see my screen in YouTube. I can't see any of you now, so if you can give me a quick share, if you just speak, if you can't hear anything, I'll just press play and let it to go.
It's starting, Kate, so thank you.
Here at Humber, we've designed 2 levels of leadership programmes for all of our managers and leaders out there, and for those aspiring to be in those roles. We develop them with all of our workforce, a range of people in different professions, different job roles, and of different levels as well. We really wanted to make our leadership programme something that our leaders needed and wanted, rather than what we thought they might need or want. We have 2 levels of programmes. We have our Senior Leadership Development Programme, which is for those in 8A roles and above, and we have our Leadership Development Programme, which is for those at bands 3 all the way up to 7. The reason we did it this way is because we wanted to be inclusive of everybody, and everybody wanted to aspire to be in these roles. And we know that we have team leaders that are in bands 3, as well as team leaders that are in bands 5, and potentially band 6 as well. Each of our programmes has 4 modules, and the 4 modules run over a period of 9 months, equally spread out, with the last day being 3 months or so after your last full 2 days. This gives time to reflect and to think about what's been learned and apply it to the place where we work and with our teams. So the modules we have are Self as Leader, which is all about learning who you are, what your preferences are, thinking about how you show up. This is really thinking about your strengths, but also the areas that you don't find so easy, but making sure that we don't hide away from those if they're part of our role and we need to do them, that we still find a way to act in that way as a leader, so we give the full us really and the full experience to others. Module 2 is around leader as coach. So this is enabling our leaders to learn to ask the right questions at the right time and really enhance our listening skills. It's about believing that the person that's coming to us with the problem is the person that also has a solution, and we're there as coach, as a leader, to help them come to that place. It's about changing the conversations we have on a day-to-day basis. It's about stopping talking as much and making sure we listen more. And it's around thinking about how we can escalate that into performance coaching to really push ourselves and others to be the best that they can be. Module 3 is about leader of others. So this is about bringing our teams together. It's thinking about the essential conversations we have to have at work, staff engagement. It's about talent management and thinking about bringing talent forward. It's about building really high-performing teams and leading leaders as well, solving complex problems and really being there for our team. You can see how Module 1 itself as leader and then the coaching skills help this bit when we go into work into the teams. Module 4 is leading into action. This is about thinking about change versus transition. What is the process change? What is the physical change that we're having in our service and our team? And what is the transition that our people are going to go through right through the course of that changing process? It's thinking about quality improvement, getting better all the time. It's thinking about real life change and leading that with integrity and with strength, but also showing that vulnerability. We also cover in this module performance and results. As we say, we need to be here and get the services we provide working as slick as they can, but also we get the best out of our people, which is about understanding those that we're working around. Okay, so each cohort consists of 15 people in total. We've kept the numbers nice and small because it's about you going through this programme together, learning to link in with each other, rely on each other, and building that trust is so important. And with the world that we're now working in and making the most of our virtual abilities in the trust, we now deliver a blended approach, some face-to-face and some virtual learning. We'll always watch this to see how we can make our training and development even better for all of our leaders.
Number one, it's empowered me to lead better, more effectively, for not only myself as a leader, but also for the staff that I support as my senior health trainers and also our clinic staff. It's also enabled me to kind of reflect back on and learn in terms of how I can positively improve their working life and also how I work with partners. In terms of expectations, it was more than I expected, more engaging, more interactive than previous trainings. This was every single session you came away taking something quite positive, which was good.
I've previously engaged with senior leadership training, so I think really this was a helpful refresher, but what was a really good opportunity was to attend alongside some of my peers and colleagues, my line manager and my leadership peers, and that was really invaluable in developing our working relationships, understanding each other's strengths and how we can support each other as we continue to work together.
Hopefully all positive, so definitely from the team's point of view that I've changed. So I've been doing this for the last over about 2 years because of COVID, so hopefully positive for myself. Definitely I felt different in kind of the way I lead, and again on a positive fashion. As just alluded to there, a lot of the things that we did in the sessions, you had all of the takeaways, new strategies, tools, methods that I have used, I've tried, I've a bit of trial and error with the team and still do now, which is obviously a huge benefit from the training.
I've got much more increased awareness around managing my natural introvert tendency at work, and part of that tendency is to go quiet under pressure, which is not helpful in the role that I'm in, so I'm working hard on developing that. I'm also quite discipline driven, and I think I need to be careful at what cost that comes, and ensuring really that I'm very much people focused as well as looking at an outcome focus. Quite a lot of period of change within our leadership team locally, and over the last probably 9 months we've had 5 new members of staff within the team of 8 that I directly line manage. So that leadership training and support has been really helpful in terms of that. I have had some really positive feedback, which has been very nice in terms of the kind of the support I give, but also the structured engagement and coaching support that I've given to people over the year.
Not in a negative way, but realising my own limitations for myself as a leader. I'm confident in the way I am as a leader and as a supervisor. However, actually learning how I can deal with things more effectively and things which I'm not so astute with and not so keen on, and also being able to link in with the other staff members who went on the course. I think that was a big thing, is actually not feeling like you are in your own bubble. You're actually with a lot of different people along the whole of the Humber Trust, which is nice.
My biggest learning from the course, I think, really was probably some of the theory around high functioning teams and how to ensure high functioning teams. We've got lots of change. We've been in a period of change really since our services were commissioned, and we'll have more change coming along in the future. So ensuring that teams know and understand each other to help them grow together has been really important. I've also been able to use some of the learning for my own NMC revalidation in terms of reflection and CPD requirements, and that's helped me successfully revalidate earlier this year.
This is very cliche, but the whole thing, I said to Jared throughout the whole of the course that it's been spot on. There was nothing I could say was a bad thing, aside from the lack of connectivity in the last year, but that was down to COVID. But still, just this afternoon, myself and about 4 of the other staff who were on the course have actually had an MS Teams to just have a nice catch up and just to see how everyone's going, which is really nice, and we plan to do that continuously.
My favourite element of the course is probably the time away from the workplace, and quite honestly a nice lunch, because that really was different to the usual working day. It kind of makes you feel a bit valued and appreciated, and I appreciated that opportunity to go to nice surroundings and to have that little bit of time. And I think the words I would use if I was recommending the programme to others is around that really. It gives you that time to step back a little bit, consider how I respond personally to things, and also how I engage other people in all things leadership and development across our services. I would
get you to sign up for it straight away, regardless of where you are at in your career, within your team, where you see kind of leadership. I think it's for everybody. I would definitely say it is something everyone can get some benefits from.
So far, both the senior leadership and the leadership development programmes have had one cohort completing, and we're now restarting the programmes with the next year seeing a lot of courses being run to get through the number of leaders and managers we have. It's really important that we get this right for our workforce and making a difference to all of our leaders and all the people that those leaders come into contact with. We'll keep reviewing it, we'll keep making it better, and this is about you, this is about making a difference for you.
Thanks for that, Katie. That was really good. And I know there's some really good comments in the chat box. And I know firsthand from speaking to the staff governors what the positive feedback's been about the impact of this individually and collectively for the organisation. So well done to you and the team for putting this on and for driving it forward. Fantastic. And as I say, I do hear around the trust the positive impact it has had. So I'll take questions. I think Mike Smith, you've got your hand up.
Thanks, thanks, Sharon. Excellent, Katie. Thank you, and great to get the staff feedback. It sort of takes me back to some of my younger days and some of the meetings I have now, where you end up on one subject but actually make links across organisations, and they're really, really powerful in terms of team working and so on. I'm just wondering whether you might be able to progress to either a next stage or a side stage, so you're getting a lot of peer support across the organisation. I'm just thinking about up and down in terms of EDI and in terms of what it's like on the ground, and wondering if the next stage might include perhaps reciprocal mentoring.
Yeah, Mike's a really good thought. We're currently looking at mentoring and coaching and bringing that into Humber, and having a network for both of those, and also looking at action learning sets in terms of how we share and learn from each other as well. The other piece we're doing is with the ICS and looking at how we can link in from there. So from the development programme, which you've been through the development programme, you've got the option to be part of an action learning set. You've got the option to be doing some more learning around coaching and also mentoring as well, and then looking at how we feed that in. But completely with you, Mike, in terms of inclusivity and accessibility, making sure that this is going to impact everybody, and we get the people in our trust working even closer with the people in other trusts alongside us as well.
Thanks, Katie. Thanks, Mike. Francis?
Thanks. Great. As Mike said, I echo a lot of what he said, and I think that meeting other people, a lot of the benefit is meeting other people and talking to them and seeing what's going on. Just a thought, I've seen in other organisations that once the leadership programme is up and running, there's almost a staff level programme which flips it and says this is what you should expect from your leaders. And you have a ground roots version, so that the staff start to understand what the leaders have been through and what kind of leadership they should expect. I just wondered if you thought about doing any of that.
Yeah, I really like that actually, Francis. I have thought about it in terms of the behavioural framework and the work we're going to do around embedding that and what we can expect from each other and from our leaders. But I really like the fact of adding into that the bits around the programme so they can understand that as well. So thank you, that's a really good thought. Thanks,
Francis. Really good suggestion. Mike Cook?
Thank you, Sharon. Good morning. Well done, Katie, and great to hear feedback from the programmes. And I think particularly well done to get this thing started properly. It's It's really hard to get the first cohorts going on a leadership programme, particularly in these circumstances. So well done. And my two questions are, one, how do we deploy this further? I know you've got some ideas, but how do we get the scale that actually you need to come on this to be a leader in Humber? That sort of, it's a standard operating procedure, and because that can really give people a sense of control and a sense to operate, and that's very important in a distributed organisation. Secondly, the theme of the two sort of commentators was about change. Change is a constant in the NHS. Do you think we're doing enough in the programmes on resilience and adaptability? Because I think they are two underestimated qualities in leadership that everybody needs.
Yeah.
Thank you.
Thanks, Mike. I've not got a pen in front of me, so I'm going to have to try and remember what you said for the first question. So just prompt me if I'm not there. So the first one was around, I've already forgotten already, was around leadership, and
it's about how you deploy it. How do we scale
Brilliant.
it up? Deploy it. Yeah.
Yeah, thank you. So what we're planning on doing is we want to run a few more cohorts, and both Jen, who's an OD practitioner, and myself are shadowing some of them as well. And then once a few more cohorts have run, we can get some more data around how is it landing for our leaders, and is there any gaps, and what is it that's working, what is it that's making the biggest difference. And from there we think about how we can expand that out even further. I do completely agree about when you're a leader at Humber, this is what it's like, this is our expectations, and this is what it should be like. And I think that can come through inductions, through leadership programmes like this as well. And what I'd like to do is make sure we pull the right bits out of the leadership programme, or it stays exactly as it is, but we'd like to run some more cohorts first to get a bit of more of an understanding of how it lands and make sure it's the right thing. The second question, just remind me just a few words, Mike, sorry. Oh, you're on mute.
You're on mute, Mike. Sorry, you're on mute.
Okay. Leadership in a changing environment.
Yes.
Resilience and adaptability are two things that we all need more of, and we always need to refresh. So just a comment, really, just think about how you might build those into the other sorts of interventions, and keep them centre line, I would suggest. Well done.
Thank you.
Thank you.
Thank you, Mike.
Thanks, Mike. Michelle? Yeah,
good morning, everybody, and thank you, Katie. And it was great to have the video as well, because we can continue to use that, can't we, and disseminate it out. And so I think that's a really good tool, and obviously it fits our sort of communication profile as well. Great start that the board off with the staff stories on. It's good that we're alternating. I think for me, I do try and, I do attend the beginning of each of the sessions just to welcome the people in, and the spirit in the room is great. And you get that feedback straight away. So I think it is exceptionally positive, and we've got to continue to build on that. It has been challenging with COVID, but I think the blended approach that we've got now is really good. That makes it sustainable as well. And I think there's some useful points around the table. I think one of the things that we are going to do is look at that behaviour. We've got a behavioural standard. How do we link in some of the work that we're doing in the leadership sessions into that, and also start to develop contracts, which I think is a bit what Francis was saying. We expect this, you can expect this, and we work that up in partnership as well. So I think it's really exciting. As I say, the feedback that we've had from the first cohort has been amazing as well. So it's obviously hitting the mark, because we want to make their time really valuable. I do think the resilience piece is important, because I know there's some sections in the course around resilience, and I know that we've got quite a bit of resilience piece on Shiny Minds app, etc. But I think we probably do need to, as part of our recovery and restoration offer, do something that's more structured around helping and supporting people's resilience in its widest sense. And I don't just mean for managers, I mean across the organisation. So we perhaps can take that away, Katie and others, and Steve, and just give that a bit of thought.
Thanks, Michelle. That's really useful. Hilary?
Thanks. The Proud programme has been a real success for the trust. I think the people that I know that have been on it are just so positive about what they've learned on it, and it's given them quite a change and a step up in their leadership style. I think my comments, really building on the two Mike's comments, is about this should just be the start of your leadership journey, and it's how we continue with those people as they go through the cohorts, that they then embed what they've learned in practice, but how we support them to embed it in practice as well. And I know, Katie, you said about action learning sets, mentorship programs, and I would really want to see that we really do encourage people once finished that this is the next step of it. That was just the start. It's almost a program for life, if you like, you know, obviously tailing off at the end. So it's something like, I don't know, 6 months after you've finished, you know, almost touching base with people. Where are you now? What's changed in your practice? What would be for me something where this has really failed is if they do this fantastic program and it's been a bit of a tick box for them, you know, get it on the CV, I've done a leadership program, and then nothing's changed for them, and that's not what it's about at all. So and I've already said to your team, I'm happy to support in any of this at all around mentorship, etc., to really try and get some of those senior leaders on, you know, moving along on that pathway. And the other question I just had, because I'm not sure whether or not it was in the program, was about strategic leadership, because that's a conversation I have a lot with my team, is about how to, you know, strategically lead, influence, etc. So I don't know, Katie, is that actually in the programme? Is that covered, or is that? It is.
Yeah, so sorry. In the senior leadership programme, the strategic piece is very heavily there. In the last cohort, in the last module 4, and actually we have 3 days on that in total. So we have the 2 days together, and then part of the reflection day includes that as well. That's so far with the first one, that's the one we felt that leaders have really got a lot from in terms of thinking about that strategic piece, and that's what we want to develop on further. And whether or not we need to do some more work of that coming out of the programme, we can look at. And in terms of, I know the word sort of resilience has been used, and what we do with the leadership programs is very much about learning about who they are as an individual, and learning how they look after themselves, learning how they apply themselves, learning about how they recharge, how they say no to things, how they let other people take the lead, empowering others as well. So when we think about resilience, I kind of think about it in that bigger piece about understanding more about self. So how do I look after me? What do I get? What are my triggers? What's going to get me going? What's going to make me buzz? What's going to get me excited? And where am I going to falter? And it's about that learning. It's really, really positive to hear the board being so for us, making sure this is just part of the journey. This is just one step towards all of that support about our leaders, our behaviours, our expectations, and setting the culture and the tone of the organisation. So yeah, we've got lots of things planned, and I really welcome all the positive comments and suggestions from today. So thank you very much.
Thanks, Katie. That's really, really good. And there's even more suggestions, I think, in the chat box and comments. So you might want to have a look at those as well at your leisure. But no, it really is good. And as I say, we can all see and feel the impact it's starting to make in the organisation. And I know from speaking to some of the staff governors, they've enjoyed speaking to some of the board as well. I think Michelle and Hilary, I think you've been and obviously quite often and talked to them. And on a more personal level, I think, as well, and they've enjoyed that. And I think Dean's due to go shortly to the June one, so that's really good as well. But absolutely, we support it completely, Katie. As I say, just the start, really, but a really important start. So huge well done to you and the team, and thank you very much for joining us this morning.
Thank you very much, everybody.
See you soon, Katie. Thank you.
Thanks, Katie.
Okay, so with that, great start to the board meeting, and it really is important we have, as Michelle said, we alternate the staff stories with the patient and volunteer stories as well. So really good to hear from the staff story this morning. So if we go back to the formal part of the meeting then, so apologies, as I say, we didn't have any. Declarations of interest, item 2, you've got the paper that's been prepared and noted the new declarations. I'll say the same as always, if there are any changes, please let Jenny or Jess know. And if there's anything on the agenda where you need to declare an interest, please do so. If we could please move to the minutes of the meeting held on the 28th of April. Are there any points of accuracy that you've not already let Jenny know? Any actions that are not on the actions list? No, well, we'll take those as a true record. Thank you very much. If we could then move to item 4, which is the actions log and matters arising. Anything on this? Page 1? Page 2? No, that's great. Thank you. We've already covered item. Oh, sorry, Francis.
Just to say that I've been on the MAPA session, and it was really helpful, really informative, and really interesting.
Oh, that's good. That's really good. And I think Mike, is hoping to be able to do that when circumstances allow as well. So thank you for the feedback, Francis. That's really good. Okay, if we can move on then to item 6, which is my chair's report. Well, firstly, obviously, it's only been a few weeks since the last board meeting, so it's a sort of a joint apology and thank you, really. So apologies that just a couple of the papers were very late going out. As board members were aware, the board meeting was moved early for the original reporting schedule that we have to nationally comply with. And then obviously that changed because of COVID. So it was always going to be a challenge to get some of the papers out for the shorter time between the boards. So apologies for the lateness of just a couple of them. And a really big thank you to the exec team, particularly for turning around the papers so quickly, because inevitably it's just like finishing one board meeting and then starting for the next. So thank you to all of you for doing that. In terms of my own report, really, I'd just like to update you on the associate non-exec position. We've been really busy with that since the last board meeting, long listing, shortlisting. And we are interviewing next week. And I know quite a lot of the board are involved in the stakeholder groups on Monday, and Michelle is involved as well. So really looking forward, and fingers crossed we get a really positive appointment next week to that role. I've carried on in my role as staff wellbeing guardian, attending the staff health and wellbeing group that Lynn chairs. Still a very, very active group. It's always a pleasure to go. They're driving the priorities for staff health and wellbeing in the organisation, and it's an absolute pleasure to join that and hear the staff from all over the trust coming together to absolutely drive that agenda. But in the run up to obviously myself leaving in September, as we know, Dean is the deputy, so I'll be handing over to Dean just to ensure some continuity in terms of in that role. But for now, I shall continue attending those groups, and it is really good to do so. I had a really positive meeting with Caroline Flint last week, the new chair designate, and Caroline and I will continue to work together in the run up to Caroline taking up the post in September. Carried on with various system meetings, and in particular the Yorkshire and Humber chairs meeting, which is all the chairs across the whole of Yorkshire and Humber, and it's nearly always absolutely full attendance from all the chairs with national speakers and things, so it's a really good meeting. Michelle and I have carried on with our virtual quarterly staff awards, and the last one was really well attended, wasn't it, Michelle? There was loads of people on it. So this is for people of long service, retirees and employees of the month. And we had a whole team as Employee of the Month this month, so that was really good to see, the Pocklington team. And we're doing our best with that because it's still really important that we acknowledge those things, even though we can't do it in person yet. And I think I'll stop there unless anybody's got any questions. No, thank you. Well, if we move on then to item 7, which is the Chief Executive Report, Michelle.
Yeah, thank you, Chair. And can I just reiterate the Chair's comments about turning the papers around very quickly? I know it's been a really, really short time, but I did actually say that people have got a little bit longer for the next one, so it does balance itself out. There's no publications report this time because it's been very much heavy with the planning cycle. So the things that there has been a couple of minor papers, and they're actually incorporated in my report. Couple of headlines. I've actually put some visuals on, which is quite unusual, but I just thought that they were quite interesting. So we've stepped down Gold Command at the moment as NHS has gone into level 3 and as our COVID figures are reducing. So we've still got a COVID group, a steering group from operations that are in force alongside the clinical advisory group. So the other substructures are still there monitoring the situation, but the formal Gold Command arrangements have been stood down, which obviously includes Silver Tactical and Silver Strategic, etc. But they'll be stood up and they're ready to go should we need to. I'll come back to blended approach when we do a very quick COVID update. The Whitby pictures, I did have the pleasure of going up to Whitby again a few weeks ago to meet the staff up there, just to thank them for the great work that they've been doing, but also to see the new build, and it's really coming along and it looks really fantastic. And as you'll see, I'm not particularly partaking in heights, but I was persuaded to go right to the top of the roof, and it was a very windy day, but you'll see I got some fantastic views of Whitby, but more so of the actual developing hospital site. And it's really good to see, you know, that the design that's been jointly done with our staff, etc., up there, and it's really exciting. It's a couple of weeks behind, but that won't affect us at all. So I'm looking forward to that developing over the next few months. I've also put some pictures of our vans, which may seem a little bit odd from your calendar.
You've gone on. You went on mute, Michelle, just briefly.
Oh, apologies, sorry. I don't know why. Sometimes it does that. I think I just get a bit over quick. Yes, I put some pictures on in relationship to the vans, just because it's a brand new design for us. So obviously, if we'd have been out and about a lot more as we would have seen them, but they're great. And thanks to communications, and particularly Adam, actually, who designed them. And I must admit, when I saw the design on paper, it looked a little bit, but I think you'll find they look really good. And they've got the Unbelievable sticker on the side as well. So they're really good. And obviously, as we move into our electric fleet, and thanks to Pete and the team as well. I've mentioned breastfeeding. As you know, I'm the breastfeeding guardian, but also just to say that we've maintained our gold status. Now, if you remember, that's really difficult to get at the best of times, but to maintain it during a pandemic is absolutely truly amazing from everybody, and it's a joint process with the local authority as well. So thank you to everybody there. This year we're sponsoring the Hull Daily Mail Awards, so that's really again positive. So we can support that. So we've already had some positive media stories in the Hull Daily Mail about the organisation as well. So that's really good. You'll note that John has accepted, which is thank you to John and Great, the Health and Equalities lead for the organisation. So we'll expect more reports and more information on that as that develops. I've put the publication of the policy report in there. Just a couple of other bits. COVID, you'll see there's a long report. Obviously, Lynn will be able to answer any questions on that. But I've mentioned the blended approach. We're continuing to progress that. And that is staff not coming back into the offices, but booking offices and having that blended approach between working remotely, meeting colleagues, having supervision, but the majority of meetings being done on Microsoft Teams. And that has been really well supported by staff. And that's come from staff feedback. The next major bit, which is incorporated in Steve's report alongside the COVID and mine, is the restoration and recovery work that we're doing. We've asked staff a lot in relationship to what will make a difference. Morale remains high, but people are really tired. So how do we do what we've been talking about in relationship to resilience and other things? And we've got a plethora of fantastic ideas. Some are really for teams. Some are probably a little bit more for divisions, and there are a couple that we can look at from a trust point of view. So I'm working with Pete at the moment just to see how we can do some sort of structured budget for individual managers that they can use with their teams to develop some of those thoughts a bit further. And then I'm also working with communications and others about how we have some more thank you events across the patch over the late summer. Because I think that would be really good as we can obviously start to get into the lower restrictions. Lots and lots happening. There's also the piece on the election there with our elected councillors. There has been a little bit of movement, more on the actual chairmen and leaders, etc. later. And there's a little bit on the integrated care system, developing both North Yorkshire and York as a partnership system and the Humber 4 as a partnership system. The provider collaborative work continues that I'm leading. And we're having a lot of intensive support and conversation with NHS about our developments, but we are seeing an exemplar of best practice for the provider collaboratives. There's a lot in the report about quality accounts, so I thank Hilary for that. And I'll draw your attention to the media stories, which are really positive, and the Health Stars work. And I thank Mike for a really positive charitable funds meeting yesterday, which you'll hear more about later. And there are some policies on page 15 to ratify. Quite a lot there, even though it's only been a few weeks, because there's a lot happening. But I will pause for breath, put myself on mute slightly, and answer any questions, Chair.
Thank you, Michelle. As you say, a lot going on. I'll take Mike Cook first, please.
Thank you. Thank you. And thank you, Michelle. It's only 3 weeks since we've had one of these reports, and there is a lot going on. So well done to you all as a collective team. That really shines through. And if I may, I'll just comment on, I think it'd be a bit of a theme about consistency of deploying things over this meeting as we look at effectiveness and governance and things. But if I may, just on 5.21, which is the quality piece, you'll notice the quality priorities recommended from the Quality Committee, and we're meeting again on the 2nd of June, Hilary and John. But we're recommending the same with a bit more stretch, and I think there's some method in that because I think we've done well with them. I think it's put us in a proactive state. So I just note that for you. I think looking forward to seeing the quality account. I think we're seeing the first version again at the quality committee. It's great we're doing that. You know, so it's a bit discretionary sometimes, but we think it's a very key feature of what we do. So I'm really pleased to see that. Can you still hear me? There's a bit of background somewhere.
Yes,
yeah,
we can, Mike.
And I think in just terms of 5.32, the 5th research conference has been launched. What a great to see, John, the blended approach that Catherine and the team have suggested. So I think as non-execs, some of us are going to appear live, hopefully, and some will be virtual. And I think it's a great opportunity to build on a virtual conference that worked very well, despite you know, complications. But I think there were about 300 involved in that, as well as the sort of idea of people in the room networking, and hopefully, if we're allowed to do that, but safely. The other thing I would just say, thanks for the note on Health Stars. I think it's being re-geared. I think just reframed our relationship. Thanks to Steve and Andy and others involved in that. You know, 93 staff wishes coming forward, you know, that's really good to see, and I think that will reboot the sort of deployment of how we use our funds creatively. So their comments, well done, and I think there's a lot of consistency now in how we deploy things, as well as start new stuff too.
Thank you very much, Mike. Michelle Hughes.
It was just to highlight something in the very comprehensive report before you went to questions, and it was simply about the digital development plan, which has been developed for the year ahead and aims to obviously deliver continuing improvements. There are some really key elements in there of our strategy, including the development of intranet, dedicated information sites, and enhancing our stakeholder newsletter that will further raise our profile. And our previous goal, the successful development of our website, has led to an increased use of access via mobile devices, which demonstrates easier access, etc., which meets one of our key objectives. And just like that, the digital development plan will also be tracked to demonstrate progress.
Thanks, Michelle. I'm afraid Mike was obviously quicker on the button than you, but at least his question wasn't on that, was it? So thank you very much for adding that. Francis?
Thanks, Chair. Again, I'd echo Mike's comments. Really good stuff going on over the last 3 weeks. A couple of points from me. Around COVID, I was just wondering what it was like in terms of the new variants that are floating around at the moment in our particular area, and then picking up, going through it a little bit, the long COVID, where we are with staff and long COVID, and how many people we've got on long COVID and how we're dealing with that. Second one was around the nursing students, which I thought was really good to see that there's been a big uptick, and also a big uptick in mental health, which is great news, and presumably will be on the ball to try and ensure that we get as many of those as we possibly can. My third point was around the CAMS experiencing this increased demand for community and inpatient, and just, you know, if there's any updates on that, that would be useful. And my final point was on the in Lynn's section on 5.11 around the COVID-19 restrictions and the local labour market, and the fact that Hull is the worst impact and the slowest recovery, and how that's hitting us as an organisation.
Well, you were testing, we'd all got a pen there, Francis, I think, so thank you for that. So can we start with John with the COVID variants and long COVID, John, if you don't mind?
Well, just picking up the COVID variants, I think there's a lot out there, Francis, in the pattern, and you mentioned the local picture. I think the challenge for us is it depends where you mean by local, if it's down in Hull or up in Whitby, and right across, because we cover that huge geographical area. So I think what I would say, whether it's a variant or whether it's the Kent strain, it's keeping it simple, keeping it stupid, and one is get yourself vaccinated, and two is, particularly in our occupational health setting, is continue to comply with the systems and processes we put in place with regard to infection control, which include social distancing, hand washing, and regular lateral flow testing. And then what people choose to do in their own domestic circumstances and life, Francis, just relies on, dare I say, that ubiquitous phrase, common sense, which fills me with dread sometimes when it's dished out, because there is that challenge, isn't there? You can get down the pub, happy days, yet in your occupational space, you're quite rightly working in a different way. So I think that is challenging for all individuals, not just in Humber Trusting, to get their heads around some of that. But look, in terms of where we are, we're still doing the lateral flow test, and we've got over 50,000 results in, and thankfully we've had no recent outbreaks. But it's about continuing to keep people interested and alert to the topics. And the one thing you've noticed, Francis, we've just referenced LAMP testing, which is something that we're hoping to go live with in sometime in June. And I think that'll be an opportunity for us just to re-engage and refresh with the whole infection control calendar. And in terms of the long COVID piece, there is a bigger NHS national trust, a sort of national response to that, what long COVID looks like. They're starting to figure out what a long COVID clinic would look like, and essentially it's going to be complex and multidisciplinary. And as yet, we don't know what that requirement or demand is going to be for our own staff in terms of long COVID, let alone the wider population. But part of me thinks that if you think about what a pain clinic how it might be structured in terms of multidisciplinary approach, which includes physical health and psychological, psychiatric support, to me, there's probably more physical in a long COVID clinic, but it'll be along the same component lines. The challenge will be, I think, for the NHS is finding busloads of people that will need to operate these bespoke services, but we'll learn about that over time. So hopefully is that enough for you, Francis, on the variants? A little bit of infection control thrown in. Apologies for that, Hilary, stealing your thunder, but and then a little bit about the long COVID piece.
That was great on long COVID, John, and great on how we deal with patients. I like the approach you discussed there. Have we got many of our own staff who've actually got it?
Yeah. Do you want me to come in there? Sorry.
Yes, I was going to ask Michelle, if you've got your hand up, is it on this point?
Yeah, well, we've got a staff working group. We have got a few. I mean, Steve might have the exact numbers, and he's got his hand up. We have got some staff that have been off sick for a long length of time now. It's in the very small the small numbers, but as I say, Steve might have the detail on that. But we have got a staff working group looking at long COVID and how we work with that. I know that a couple of our neighbouring organisations are starting to look at developing services for the general public on long COVID, but again, it's a lot better now we've got some definition for that, because before we were working in a bit of a vacuum. Going back to the Indian variant, we haven't had any that we know of in relationship to the variant within our working population in the organisation. There have been a couple of minor outbreaks in the north of the patch with the Indian outbreak, but they're quite small at the moment, so they're just being observed. Not so much in Hull actually, which considering Hull was quite a hot spot before, but there have been a couple of minor outbreaks in the North Yorkshire patch, but they're subsiding now, but they are keeping an eye on them. So unless Steve's got the exact details, is that helpful, Francis?
Thank you, Michelle.
That's great.
Steve, I'll bring you in. You've got your hand up.
Yeah, so we've got 4 staff, Francis, that are off sick with long COVID and have been for a long period of time. Obviously, we've got other staff that have got symptoms of long COVID but are in work and are working and managing that, and we're managing that, and probably the effects are such that we can do that in a number of different ways. So you know, each individual case is taken on a case-by-case basis, but we are as supportive as we can be with regards to alternative duties, helping people to get back in, phase back in, and do that kind of work. But yeah, the long-term impact of long-term sick is 4 at the moment.
Thanks, Steve. That's really helpful. Hilary, do you want to pick up Francis's next point just on the nurse students and trying to recruit them in?
Yes, we are working very closely with the universities. We've got larger numbers of students coming in, which is fantastic in one aspect, but then getting placements is obviously the pressure that we're under to get all those placements for this increasing number that we're getting. But the team are working really well with the divisions, and up to now we've had a lot of success, and certainly the universities have come back saying big thank you to us for the effort that we've put in getting all these placements for the students.
Thanks, Hilary, that's really helpful. And then Lynn, if you could pick up the comment, because I was going to raise this about the potential exacerbation of COVID on health inequalities. I think that was one of Francis's questions as well.
Sorry, Sharon, I couldn't quite hear the question then.
Oh, sorry. You've made in your report, as part of this Chief Exec's report, there's a comment about COVID and it could exacerbate health inequalities in the labour market. I think that was Francis's comment, and I think you just.
Thank you for the question. So that comment is in relation to the individual placement support service, and obviously that service specifically supports our service users in our mental health services into employment. Or additionally, actually a new element to that service is supporting people already in employment to remain in employment. So I think the evidence base is incredibly strong around employment on health outcomes. So I think we knew anyway that the socioeconomic impact of COVID was going to be significant. But I think what is interesting is to see that employment statistic, particularly around Hull. And I understand that that's particularly due to the nature of the types of industries that we have here. So I guess really it just makes us even more focused on how we support our service users in this really important area to maintain and to gain employment. So recognising that, particularly over the coming sort of, year or two, unfortunately, that's probably going to be made even more difficult. So I think for me, Sharon, as well, it really connects with our sort of recovery strategy that we discussed at our last board as well. Really how we open up, not just in terms of opportunities for paid employment, but how we support people into volunteering type roles and education and training as well. So I just think it's important that the board recognise that context around the work that we're doing there.
Thank you. I think that's really helpful. And John, I think it's great that you've agreed to take on the lead for health inequalities. I think it's really important. As part of the Yorkshire and Humber chairs meeting that I attended, that I mentioned in my report, there was also a report back to us from the ICS about the impact EU exit is having on, or could have on, health inequalities. So I think if we could just pick that outside the meeting, because inevitably they're all linked in a sense of the impacts they could have on the same population. So I think, John, if we can just have a conversation outside the meeting, I think that would be helpful. Thank you.
Yeah, look, I'm happy to have any conversations with anyone around health inequalities. I just want to set my stall out from a personal perspective in here. I think there are things we can do in the NHS to reduce the effect of health inequalities, but ultimately health inequalities are the outcome of the way we've structured society, with the way we provide services and the way we educate our population and how we distribute wealth. So from my personal point of view, the NHS needs to be really careful that it doesn't set itself up as being able to fix all the health inequalities in society, when I think we can perhaps do something about 15% of the work. We've had things like the Marmot report 2 decades apart and nothing has changed. So we're absolutely going to do our best, look at some data, see what bits we can do to support our staff, to support our vulnerable patient groups. But I just don't want to fall into the trap of thinking we can fix everything. And you mentioned Brexit, Sharon, and I think my views on that are well known, and the implications, particularly for Eastern Europeans who live amongst us in our communities in the Humber region. So positive piece of work that we can do, but I think it has to be a national effort too, beyond the NHS. Sorry, I just have to put that out there, my personal perspective on what's been given to me as an organisational task.
No, that's fine, John. No, this was more linked to possible quality implications for services and the data that they can provide. So it was a bit more geared to the NHS particularly. So as I say, we'll pick it up outside. Francis, did that cover all your questions, or have I missed anything?
That covered everything. Thanks, Sharon.
That's great. Thank you. Peter, you've been waiting really patiently. Peter?
I'm a very patient person, Sharon, but thank you. No, as part of this report, we are being asked to approve the quality priorities, aren't we? So I've just got a couple of questions on those, if that's all right, on page 38. So I'm looking at priority 4, and me and dashboards. I love dashboards, but 2 things about dashboards is, one is the data's got to be correct, or as correct as possible, and they've also got to be up to date in real time, if possible, or as near real time as can be. And I just wondered, in terms of safety, how are we ensuring, if you like, or getting as close to making sure that the data on the dashboards is accurate and it's also up to date, so that there's no point looking at data a couple of months later and reacting to it. You need up to date data to ensure that things are working. For online staff who are on the front line, they need up to date information, accurate there and then, don't they? So I just wondered how we're just squaring that one off, with this new system that we're developing. I suppose for Hilary.
Hilary?
Thank you. The Datix dashboards are real time, Peter. So the minute you put in an incident on Datix, it pulls straight through to the dashboard. So it's as accurate as the information that's put in by the team. Some of that accuracy is checked anyway all of that accuracy is checked on a daily basis by this safety huddle anyway, in terms of the impact of the harm, etc. So that's all checked anyway, but it is real-time data that they're looking at, and that's why this is such a good thing to put into the trust, because they can, if they're using that in their safety huddles, which is what we are pressing for them to do, and I know that lots of teams are doing that. They're looking at what happened the day before, the week before. They can look at trends, they can look at themes as it's building, they can look at hotspots in terms of times, they can look down to individual patients and the number of incidents per patient. So it is real-time data. So we really want to get the teams using that in their discussions to inform those safety huddle discussions.
That's really great, and also you need to train. The training will need to follow that, because not everybody's comfortable with that sort of.
Oliver's going out to the teams and showing them how to use the dashboards. So he's got a programme of work this year. So a lot of teams have already been trained in the use of them, but that's his plan for this year, to get out to the teams and encourage that use, together with the patient safety team, trying to get people to get those safety huddles in. We can't go out to everybody and say, you've got to have a safety huddle. I know that's, I'm having to back off on that. That is not, the research says it's to come from the team. The team need to own the safety huddles. That's the way that they work the best. So there's that encouragement, that support, that facilitation, but the team have got to want to do them. And I can see where the teams have picked these up themselves. They're really working well.
I think John, thank you, Hilary. I think John wants to come in on this point as well. John?
So just a simple point, Pete, you're spot on around the accuracy and the timeliness of the data. The other things is the skills and experience to accurately interpret it. So if we take our own integrated performance report, where we've moved to SPC charts, occasionally we have the conversations where, well, that's a trend. No, it's not. So just having that side knowledge at all levels to look at our own data and make sure we understand what's going on. And then also moving away from things like RAG rating, which in terms of data and intelligence aren't particularly helpful. So the timeliness and the real-time stuff is really where we want to get to. But I think we're well on the way on that journey, in fairness, and particularly the work that Pete's team and Richard Vokes and stuff has led on has been really helpful in just getting us all to think and use data differently.
Thanks, John. Peter, have you got any other questions?
Yeah, no, that's great, and thanks for those answers. That gives a lot of assurance on that. The other question is possibly easier. So 21-22 quality accounts, we're not going to have any, but it's going to be certain data is going to be incorporated in the report and accounts. And I just wondered, it's possibly not for answering now, but because it's in the report and accounts, to what extent are the auditors going to be auditing those figures? Because they audit the whole of those accounts. Are we actually subjecting the figures on quality to a more rigorous audit in 21-22 as a result of this move?
Hilary?
Pick up on that. So we haven't received any detail yet about the accounts going forward. Obviously, as you know, this year they're not auditing any of those quality indicators. I mean, I would assume that they would want to audit indicators in the quality aspects going forward, but we've not received that information yet, Peter. So as soon as we do, obviously, we will be able to brief the board on that for the accounts going forward.
Thank you.
Okay, Mike Cook.
Quick input there. I'd like to see Quality Committee have a bit more input into the audit planning programme, so that we can use our new relationships with external internal audit productively to really look at, say, whatever it is, safety or some aspect. Okay, thanks, Peter.
Thanks, Mike. It's helpful. So just to be clear on the quality counts, obviously they're going various places as detailed in the report, and including the quality committee, and they're coming back to the July board, aren't they, Hilary, the sign off? Okay, are there any other questions before I go to the decisions? No. Okay, so Jess, the first thing we're being asked to do is to approve the refreshed quality priorities for 21-22. Are we happy to do that? Yeah, any dissensions? No, that's fine. Thank you very much. Hilary, can I just make a request as well? In the next steps bit, can we just make sure we involve the governors in the process as well, please?
Yes.
And then we are asked to approve the 4 policies, which are on page 40. So they are the access to health records policy, the human rights and equality policy, the section 117 policy, and the lease car policy. Are we happy to do that? Yes, we're going to ratify those. Any dissensions? No, thank you very much. I think I've covered the things that we needed the decisions on to that. So if we could move then on to, please, the item 8, which is the performance report, Pete.
Thank you, Sharon. So this is the performance report for April, usual format with commentary on each section included on the front cover. I think I'd draw the board's attention to cash and the fact that we have seen a reduction in month, but this was expected, and we knew our year-end cash position was higher than it would normally have been, and that is primarily down to timing differences between some of the year-end allocations we received and the actual physical cash leaving the bank account for those schemes. So other than that, I think, you know, I'd be happy to move straight to questions, Chair.
Okay, thank you, Pete. Sorry, can I just, I may have missed it, because obviously this was one of the papers that obviously just came out. Is there an appendix to it as detailed on the front cover?
Ooh. There should be, Chair, if there isn't.
I might just have missed it. Could somebody just check while we just take questions? Apologies if I've missed it. So I'll take Francis first, please.
Thanks, Chair. 2 points. Firstly, it would be remiss of me, having pushed it for months and months and months about waiting times, not to say well done to Lynn on the charts for this month, because they have all started to head in the right direction. So just well done to the team on that. So thanks for that. But on the flip side, I just picked up on the out of area bit, which obviously went up quite dramatically, and where we're heading on that. So well done on one and what we're doing on the other.
Thanks, Lynn. Do you want to respond to that?
Yes, thank you for the first point, Francis. So good, as you say, to see that the data is demonstrating all the very detailed, comprehensive work that is happening around awaiting times, and obviously just to note as well that, you know, we are doing that in the context of having recovered all of the activity across all of our services too, and some services obviously are seeing an increase in demand, so lots of work across all of services in relation to that. Yes, in relation to out of area placements, Francis, what's contributed to that over the last month significantly is as a result of the impact of the work that we're doing at Maester Lodge. So we've got 12 beds there, but we're only able to occupy 5 of them at the moment. And obviously that's due to the capital scheme, which actually is going to give us a significant improvement with an additional up to 5 beds when the works are completed. So that has meant that we are using out of area beds. It's a contract that we've had in place with Navigo, actually, which means that in terms of distance, obviously it's not ideal, but it's not too great, and it does mean that the clinical input into the pathway for those service users is comprehensive and actually is working well overall. So those works will be concluded sort of towards the end of June, beginning of July. So that will see a reduction, obviously, in the number of beds that we're utilising there. Having said that, there still is use of adult out of area beds currently as well. There has been some reduction, but we are still working hard on that. Demand for out of area beds for adults in our mental health units has been high over the last month or two, so connected to the COVID report really, where we have been sort of for Opal 3 in terms of operational pressures. So we are working hard anyway to reduce those. So I am expecting some improvement in that over the next month or two for the reasons that I've said. But we really are, really wanting to get it down to as close to zero as possible. Obviously, there's a national direction still around the long-term plan around eradicating the use of out-of-area beds. We're really focused on that right now.
Thanks, Lynn. That's really helpful. Is that okay? Yeah.
Yeah.
Francis? Yeah. If we can move on then to Peter Barron, please.
Thanks, Sharon. Yeah, I was going to ask about out of area as well, and thanks for that, Lynn. Perhaps it might be useful to consider, because some of it's planned, because we're sending patients to Navigo, which is not that far out of area. It's only in Grimsby. But and then some of it, I guess, is not planned. So it would perhaps be useful to have narrative on that chart, whilst we're in this temporary situation of what is planned out of area and what is sort of unplanned, if for want of a better expression. So that's perhaps a suggestion. And I've got two other questions. I've just lost my sheet. The first one is the use of bank at the Humber Centre it seems to have gone up. Most of the wards there either seem to have 40 to 50% use of bank. So I just wanted to sort of just ask the questions as regards continuity of care for patients, really, in terms of if we're using bank staff and perhaps different bank staff. I don't know if we've got the same ones week in, week out, but I just wanted some assurance there that the patients at the Humber Centre are receiving a decent continuity of care, despite the fact that bank staff seem to be increased on what they were a month or two ago. I don't know if you want to come on that one. My other question I can ask at the same time is just on the friends and family. The GP surgery recommendations has just gone down a little bit, and I just wonder if that's going to be a trend that we might see with more sort of not face-to-face appointments, and whether there's a sort of a link between not face-to-face and people being dissatisfied with GP surgeries. As just a general observation that it might just want to comment on.
Okay, Lynn, who's going to respond to some of that?
I'm happy to come in on the feedback.
Okay, do you want to start with the feedback then, John, and we'll work back?
So if I just start with the feedback, so Pete, your wider point about GP satisfaction levels is interesting. Now, you might remember this time last year in the NHS, we were outside being encouraged by the media to clap for the NHS. Some recent portions of the media would nearly have people on the streets now chasing doctors and nurses down with baseball bats, because there is the suggestion, and I'm going to be honest, in some of the media, that the NHS, particularly general practice, has been closed for the past year. Which couldn't be further from the truth if we think about, because you couldn't be closed and deliver the vaccine programme the way they've done over the last 3 to 4 months. And what's happened in general practice is that they found a way to deliver virtual work as well as face-to-face appointments. Now, undoubtedly, there has been pent-up health need which needs to be met, but sort of, general practice, not just in Humber, would have had a capacity challenge at the start of COVID, let alone at the end of the pandemic. So there is something about services and GPs and everyone working in primary care understanding that pent-up demand, but also in the same way we talk about recovery of elective services perhaps taking 2 to 3 years in the acute sector, we need to understand it's going to take primary care an awful long time to get everything back up and running. There has also been some recent research with regard to e-health consulting, which has been used and embraced in general practice, which actually showing that that has actually increased demand for services and unmet need, as opposed to make them more efficient. So while we might think that some of the new approaches in general practice have been more productive, actually they have just increased demand, not necessarily productivity. So I think I would share your anxiety about not just in our services but wider how people view GP practices, particularly if there is an unsubstantiated view out there that they are closed. Because on my own recent visits to our own GP surgeries, I can assure you, Peter, they weren't closed and there were patients being seen. However, that narrative is sometimes get lost in the red tops based on the political agenda. But we need to push back on that, because our staff, particularly in our surgeries, need a clear message from us that we know that they have been working incredibly hard supporting vulnerable patients in difficult circumstances and having to work in different ways. And any suggestion that they have been closed over the past year or so and need to reopen is frankly offensive to them and won't help them in terms of their particular morale status at this point in time. So that's my little lecture to the red tops over. But I think it's that we just need to understand that as a board. We do look at the patient data across our GP surgeries. We do bring the 6 monthly and annual reports, and where we do see a dip in some surgeries, we do take a look to understand why. Just in terms of general feedback, in our non-GP services, you know, you might see a little dip there. It's not a trend, but when we have small numbers of people giving feedback, a neutral review can sort of tip it down. So one of the key pieces of work that Mandy is doing within the, you know, the basis of restore and cover is getting our colleagues to encourage people to continue to give the feedback, because I'm personally convinced the more feedback we get from our patients, and we see that with our community survey, it tends to be positive feedback that we get, which actually encourages people that they're being told they're doing a good job, because that's coming from the horse's mouth themselves. So slightly long-winded response, Peter, to your question, but I think we just need to understand the context as a board and do some general pushback to an unhelpful approach, which is taking place, I believe.
No, thank you, John. That's a really important message, especially in the public board meeting. So thank you for that.
Yes, you're very clear, John. We've heard the message. That's very good. Thank you. Now, in terms of Peter's comment on the bank, is that Lynn?
Yeah, shall I start? And then maybe Hilary might want to add as well. So obviously, we always monitor and scrutinise the use of bank staff really closely, Peter. I guess one point to make is quite often bank staff are actually our own staff as well, covering those temporary need for additional staff. But obviously bank staff as well obviously meet our mandatory training compliance requirements. So, but probably the rationale for why there's been a slight increase, particularly across some of our inpatient areas, is due to rise in acuity, which we have been reporting through various places at the moment. So that necessitates on occasion additional staff to the existing establishment to manage that well. Obviously we would look out for, and Hilary and her team certainly do, that in relation to any of the quality indicators that suggest that increased use of bank, you know, is causing us difficulties. As far as I'm aware, and Hilary will comment, there's no data suggesting that there is any increased risk as a consequence of that currently, but obviously we do operationally monitor that very closely, as you would expect.
Thanks, Lynn. Is that all right, Peter? Answer your question. Okay, thank you. I'll move to Dean for a question, please.
Yeah, thanks very much, Sharon. It's just a point in the paper just about training compliance. So great news that training compliance is as high as it is, particularly, you know, given the last year or so. One of the things we pick up in the workforce assurance report is a sort of recognition that average disguises, you know, some areas where compliance isn't where we'd want it to be, and so we're exploring that a bit further, and we'll get something more on that at the next sort of workforce committee when that takes place. And then there's just a comment really on John's point about sort of GP practices, and I guess it is important that we listen to patients, isn't it? But also not fall into the trap of trying to get everything back to the way that it was. You know, there are some benefits of working differently for patients, and I think it's going to be a big sort of communication exercise nationally. And of course, we can play our part in that as well. But you know, how we articulate what the benefits are of a more blended approach to seeing patients, I think is going to be important as we move forward.
Thanks, Dean. Is there anything else on this? No. Can I? Oh, Michelle.
Sorry, yeah, thanks, and very useful point by Dean. Just a small point from me, and apologies, I should have maybe picked it up before, but it's on page 10 of the report and page 58, which was around the friends and family. We've picked up a little bit non-involvement of services. I just wonder if they're involved in their care. I mean, I know that's more. Is that more than just the face-to-face bit? So should we be doing more in relationship to involving them in their care? I don't know. It's just a thought maybe we need to take it away. But I know we've had a conversation. But to me, it read a little bit more detail than just that getting that face-to-face contact.
So, Michelle, I have an answer for you in that. This, as you know, is point data from month to month, and actually what we're seeing in the non-GP services is small numbers, and that's why just giving that. So actually, we don't really have enough bulk of numbers to actually say that this is a trend or not. And just the important thing is to remember in terms of, don't forget, we still have this sort of annual community surveys, which gives us very in-depth information and which has been positively reassuring over the past couple of years. We're expecting some inpatient survey data soon as well. So some of the key metrics that we look at have remained strong even through the pandemic, and actually that's where there's a real richness. Now, that's not to say that these point sets of data aren't useful, but as I said, I think the key challenge is ensuring that we get services amongst everything else we're trying to get them to do, to continue that focus on the patient feedback piece, just so we can be sure that everything is as good as it possibly can be. And that's the piece of work that Mandy is constantly doing with the services to sort of make sure that that one particular piece of data doesn't drop off.
Michelle?
Yeah, thanks, John. I think, yeah, maybe we could maybe, I don't know, is it something for quality committee? Because I think for me, yes, it's because it's more than Mandy's, it's more the community services. It's about how patients are feeling if they're involved in their care. So I just wonder if there was a bit more for us to do in relationship to it. It's just a thought, and it might be useful just to explore a bit more, either at QPAS or at the quality committee. Because I don't want to wait till the community survey comes out, because I think it's not just community, it's in inpatients and care planning, etc., etc. So I just wondered if we needed to explore it a little bit more. I know it's not statistically variant, but it is quite a huge drop for the last couple of months.
I have to say, Michelle, I don't think that's of value at this time in terms of the restore and recovery framework. We have a well-established process over the year of collecting this data. And as I said, we could go chasing some stuff. I think the key issue is increasing the number of people that give us the feedback, and that's the issue that Mandy's currently working with the teams.
Can I suggest that you just have a conversation outside the board about that? But it's been a really useful, I think, debate and questions. So yeah, if I leave you two to have another conversation about that, that would be good. Anything else from anybody? No, just from myself, I have to echo Francis's comments as being somebody who always mentions waiting lists every month. So yeah, it's good to see them going in the right direction. Even with small numbers on some of them, they're still going in the right direction. So that's really positive. The appendix has now been circulated. It was missing. I hadn't missed it. It's been circulated to board members, and we will update all the links to all the board papers for the public and the governors, etc., to include that going forward. Can I just quickly ask about the early intervention psychosis one? It is going in the right direction. Sorry, I've lost my page now. It's on page 67, but it's still well below target. So I just wondered what was happening with this.
Sorry, Sharon, could mute.
Page 67.
Yes, yeah. I think, as I've been saying over recent board, Sharon, it is a concern. We are working harder. It's a relatively small team. And as you're probably aware, the model in early interventions is very small caseloads as well. So there have been some unconnected staffing related issues in that service that has led to absence, Sharon. Okay. And just as we've thought that we have put replacement staff in post, there's been a further sort of couple of issues, unfortunately, as well. So there is a full and detailed recovery plan in place. I do expect that to start to improve now, but it unfortunately has been a little bit sort of one step backwards and two steps forward with this service. But there is a lot of focus for the reasons that I say.
Thanks very much for that, Lynn. And can I also say thank you for the narrative on the front cover this month. I think some of it was particularly helpful, for example, commentary about new bridges, etc. So it was helpful to have some narrative to go with the report. So thank you very much for that. OK, I think we've had some good questions and debate about that. So if we move on to item 9, the finance report, Pete.
Thank you, Sharon. So again, finance report as at month 1. So just some key highlights. We continue to operate under a block funding arrangement, and we've had that confirmed for the first half of this year, and no real guidance on what's going to happen from October at this point in time. There was no national requirement for month 1 reporting on finance, but as a trust we did do a full close down at month 1 to keep our financial governance going and internal reporting. But to draw some highlights from the report, we did record a very minor surplus at month 1, so for all intent and purposes we had a break-even position, which is what we're being asked to deliver. There's less detail in the report than usual, and that's a combination of timing of production of the report and also the fact that month 1 is always a bit of an unusual month because you've got the hangover from the previous year adjustments. We recorded COVID cost of 439,000 and income top-up of 205,000, and we do get funding for that within our block, and we did cover cash in the earlier performance report. So I'll stop there, but just from a point of assurance, obviously it's the Finance Committee next month, and we'll be back into our usual detailed report at finance for the month 2 position.
Thank you very much, Pete. Peter Barron.
Thanks, Sharon. Yeah, there's a couple of very easy ones, I think. In terms of income, Pete, I see we're 332 up on the month. Is that going to be a typical month for the first 6 months? So are we going to expect that trend of increased income versus budget? Or do you think that's just a one-off for April?
I think it's more of a one-off for April, Peter, and there's a bit of legacy that's hung over. And we are still in the process of confirming our final block values.
That's great, thanks. And the other thing is just perhaps next time, if we could have the cash, the underlying cash position as well as the overall cash position, just as a footnote or whatever. I know there are some like one-off items in there that are not going to repeat themselves. So if you could perhaps put that in next time, if that's convenient, please.
Yeah, not more than happy to do so.
I think that would be a good suggestion because we've obviously had lots of discussions elsewhere with the governors about it, and I know some of it's committed, etc. Pete, so I think it would be helpful to just understand for the board to understand and others the underlying cash balance. That would be helpful. Thank you. So I've got Francis.
Just a minor one, just to say, I remember a time when not that long ago, when we never got a month 1 finance update. So well done that we are now on top of it and we're actually seeing it. So well done to the team. Thanks for that. And yes, we'll have a good discussion at the next FIC, but just good to see it, Pete. Well done.
Thank you.
Yeah, thanks for that, Francis. Good comment. OK, so anything else on the finance report before we move on? No, thank you. So we'll take as an action that the suggestion for the next one, and from going forward, Pete, you'll put the underlying cash position in the finance report. So that'll be an action, Jess. Thank you very much. So if we can move to item 10, which is the Workforce Committee Assurance Report and March minutes, Dean.
Yeah, thank you very much, Sharon. The assurance report is there. First of all, thanks to Jess. This meeting took place last week, and she always manages to turn these around very quickly. So thanks to Jess for doing that. Just a couple of highlights. During the course of the last year, one of the things that we've been doing is seeing the sort of clinical areas, talking to them about the work that they're doing on their action plans. And at this one, we saw one of the sort of corporate teams, and finance came and gave a really sort of, an excellent update in terms of the work that they were doing on the staff survey, and in particular, how they're engaging that team in looking at the difference what they do makes to patient care. So really good to see that. We also had a report from the Freedom to Speak Up Guardian and got the annual report on that, which is also on the board meeting today. And the other thing just draw attention to, I think, is we picked up, as I say, just about the mandatory training. So there's a number of indicators in the trust that are all going in the right direction. So we've got, lower rates of sickness absence, lower rates of turnover, less vacancies, more nurses in post than we'd had over the course of the last year, sort of really positive. we always try and drill down and get some sort of more information about that. And one of the things we looked at this time was just in terms of mandatory training, which is a positive headline rates. We sometimes look at particular areas where compliance may not be where we want it to do. And this time we just looked at some particular focus areas, and we'll get a further report on bringing those areas up to that sort of expectation sort of later on. But the report is there, and happy to take any questions.
Thanks. Steve, is there anything you want to add? No.
No, nothing. Sorry, Sharon, nothing from me.
No, that's fine. Thank you. I just want to give you the opportunity. Any questions on this? John?
Dean, it's just a question really. Do you think you can make any inferences from some of the data we're looking for at Workforce and OT Committee with regard to the general state of morale, so to speak? Are there any proxy measures in what we look at, or is morale just one of these sort of things which is up in the ether and you kind of think it's good, or it's good, or it comes and hits you over the head at a later date? And this is just in terms of the restore and cover agenda and the general sense in the NHS that the worm might be turning with regard to public perception of their services, as we talked about just with GP practices.
Yeah, John, thank you. I mean, there are proxy indicators, aren't there, as well as absolute indicators. So there's a tendency over the recent years that we've talked less about morale, which is sort of quite subjective about the extent to which sort of people are enjoying things, and more about sort of staff engagement or sort of staff experience. And we can see some of those sorts of things in there. So you could draw some proxy indicators, to sickness absence being lower, turnover being lower. The stuff we see in the staff survey in terms of staff engagement is all sorts of positive. But I think that we also need to recognise that some of that will be driven by COVID. So I think we can reasonably expect, I think, across the NHS for turnover to increase. There were people that will have stayed in the organisation through a sense of loyalty and duty at this particular time that may have retired but have stayed on longer, and we can see some of that going in the other direction. I think it's really important that we continue to keep the focus that we've got as an organisation in terms of health and well-being of staff. So again, it has something that's got significant focus during the COVID period and has had investment, but we know that pays off. And I think as we sort of move out the COVID period and finances become more challenging, that it'd be important and incumbent upon us, I think, to keep that focus on the sort of health and well-being with staff, and recognising that investment in that area does deliver sort of positive outcomes. That's a roundabout way of responding to some of your things about proxy indicators, but again, happy to take views from others, and Steve may have something to add.
Yeah, Steve, is there anything you want to add to what Dean's responded?
So I guess overall, just so what we've got with our staff survey figures, John, particularly is some really positive data, haven't we, that maybe says with turnover and all of those suites that actually, if you look at that across the round, I think it's fair to take an inference that morale, is in a positive place, and it is in a better place than it's been maybe previous years. And I think the whole suite and that workforce scorecard and insight report allows us sort of to view that and have a look at it. So I think it is about looking at it across a number of indicators.
Okay, thank you. It's a good question, John. Really good prompt. Okay, anything else on this report before we move on? No, so I echo what Dean said. Thank you, Dean and Steve and Jess, for turning it around so quickly. We're going to move on to item 11, which is the Mental Health Legislation Committee Assurance Report. Mike Smith.
Thank you. I take it as read, but I'd like to highlight three issues, if I may. First of all, MAPA. Public meeting. This is the multi-agency public protection arrangements, and that's a responsibility that Mental Health Legislation Committee have taken over from the Audit Committee. We're making good progress with that, and members of the committee may be observing some of the MAPA meetings in the future, all to do with counter-terrorism and high-level stuff. So that's the first one. The second one is about consent to treatment. We received an audit report where we've got very good assurance on that, apart from one issue to do with forms and an action plan's being put in. The really important thing about that, not just about the assurance, is that we were given the opportunity to use some audit time by the committee. So that assurance report was done with us and for us, not done to us. So that's a really good use, in my view, of audit time to say there's an issue within our trust that we'd like to have a bit more scrutiny on and some assurance on, because consent to treatment really is fundamental in terms of patient care, and to use audit time for that we thought was a good use of time, and has come with some positive results and an action plan in one area that we're sure. The third thing I'd like to bring to light is links with the outside world, so to speak, in particular with the CQC. We've been using the CQC Insight report, where the CQC highlight the things that they're looking at as part of our benchmarking. That's the first thing. The second thing is, as far as the human rights policy amendments, we've tried to reflect the CQC closed culture and the EDI work we've done within the trust. So we're trying to move our mental health legislation committee a little bit sideways in terms of not just the assurance, but also the links with the real world. But I suppose the fourth thing, in that I've used we in our conversation. This is a team effort, and I thank very much Michelle Nolan, who does the heavy lifting, Lynn and John for their direction, and our mental health legislation committee took an hour and a half, which is going to leave us in future some time for some real deep dives in terms and strategic stuff instead of just going through the performance. So really pleased with the way that committee is going, and that mental health legislation steering group led by Kwame is also part of that effort in terms of processing the information. So a bit of a long spiel from me, but I'm still enjoying mental health legislation committee.
We can tell you are, Mike. Thank you very much. John, is there anything you want to add?
Yeah, thank you. I just want to thanks, Mike, for that comprehensive update and the positive feedback. It's much appreciated, and particularly from Michelle and Kwame. Just to pick up your point about the work around closed cultures, and board members might remember that CQC landmark publication might be about 14 months ago, which we brought to board. We signalled the fact that actually the language of the CQC was going to be all around closed cultures, but just to reassure people, the work that's been going on in the organisation predates that. So reducing restrictive interventions, actually, they're just changing some of the language, but it's important to understand that the language has changed. And even at sort of EMT in the past couple of weeks, we've had conversations about how we communicate the language of closed cultures to staff, with some sort of further communications going into the unit. So in some ways, the language of closed cultures is something I prefer, in fairness to the CQC, whereas reducing restrictive interventions maybe has run its time, but it's the same principles across both. So it's always worth going back as a board to have a look at that original CQC document, because I think there is some value in it, and it just articulates the work that we've done in a slightly different way. But I have to say, getting staff to think about the language of closed cultures over time is a piece of communications work which is going to take us time. It's not about embedding new ways of working, because they're hopefully doing that through the groups, but actually just the language of closed cultures, because that is what CQC is thinking in.
Thank you both, and I think Hillary's put a helpful comment about patient stories in the chat box, which I'm sure we can pick up. So thanks for that, Hillary, as well. Are there any questions or comments on this report? No? Okay, well, thank you very much for that very comprehensive report. So I think we'll just pause. We've been going for an hour and a half now, so I think we'll just pause for just a comfort break, if that's all right with anybody. So we'll just take a 10-minute break. So we're back at 11:10. So Adam, if you could stop the live streaming, please, and recording. Okay, welcome back everybody. If we could pick up please on item 12, the Audit Committee Assurance Report, Peter.
Thanks, Sharon. Yeah, no, we had an Audit Committee meeting last week. It was a routine meeting. It wasn't the year-end one, which we'll be having in June, obviously, slightly delayed. But yeah, we had a really good meeting. What I would say, I would take the report as read, but what I would say is that the move to Audit Yorkshire as internal auditors, I think, has been a really good one for us. I think to get that local knowledge and experience and buy-in, if you like, to the trust. And the managing director there has attended every meeting so far, so I think they're doing a really good job. But also our team are doing a really good job as well, because despite the pandemic, the draft audit annual internal audit opinion is coming out as significant assurance, which is just one level down from the high. You know, we'd love to be high, but we don't choose audit areas to examine that are easy. We go a lot, you know, in a lot of different operational areas and choose ones that where they can help us to you know, to gain assurance and perhaps suggest some improvements. So I think to get that level of significant, the year that we've had, I think that's a really great achievement by the team. So really well done to Pete and Ian in particular, but everybody who's been subject to an audit in the past 12 months. They also listen. We had an effectiveness review, and they did do like a secret monkey survey type report for us. And one of the things that came out of that was that the format of the counter fraud report we thought that was a bit unwieldy and it wasn't really well structured, and they've listened and they've now made improvements to that to make it much more like the internal audit reports, and to have ratings on the various recommendations that come out of that as well. So it's much more structured, and it's a big improvement, I think, on what it was maybe 6 months ago. So no, it's all been very positive from that point of view. We also approved the 21-22 internal audit plan and the counter fraud work plans as well for 21-22. We approved the access to records policy, and we noted the internal audit action follow-up was still a very high standard. So those are the main things really. Obviously the year-end accounts in detail will come to the next meeting on the 22nd of June, and you know, it's a meeting that I would encourage anyone to attend. You know, obviously we've got the main board shortly after that, but I think you know, it would be good to get perhaps one or two more board members sort of coming into that if possible. I know Mike is hoping to join us. Mike Cook. Anyone's got any questions?
Okay, thanks. Well, I think Michelle's got a hand up. I was just going to ask Pete if he wanted to add anything, Michelle, if that's all right, then I'll come to you. Pete, do you want to add anything?
Yeah, thanks, Sharon. So, thought it was a good meeting. You know, I'd echo Peter's comments, really pleased with the work of Audit Yorkshire and how they've progressed with the audit plan and the progress today. And I think it was really positive that we're picking up the counter fraud recommendations on the audit track, because it was something we weren't doing with Audit 1, which just give us another level of oversight on those recommendations and tracking them, which I think is really positive.
Thank you, Michelle.
Yeah, thanks. I want to reiterate Dean's comment in the comment box and the one that Peter made, really, just to thank Pete and the team, really, because obviously in the middle of a pandemic to get a significant assurance report is not insubstantial, really. And actually, when at the committee, what Peter did say was at the committee, they actually sort of said, well, we could have potentially gone to high, but we're going to obviously just err on the side of a bit of caution, I think were the words used. So I think that is not insignificant. And we have got 2 high assurance noted in the report. And if the board remember, we don't choose the areas that we know we're going to get positive results. We actually choose the areas that actually meet our operational plans and the ones that we're particularly not concerned about, but that we want to particularly get internal audits to have an opinion on. So I think that's really positive for the organisation, and we'll continue to do that. But I really do want to support Dean and others' comments about just how hard it's been, especially in the middle of a pandemic. So I thank Pete, etc., and all the team.
Thank you, Michelle. I'm sure we all echo that. So thank you. If you could pass on those thanks, please, Pete, and thanks to you. Any questions on that? No, thank you very much.
I've got a question, please, if that's okay.
Oh, sorry, John, I didn't see your hand. Apologies.
That's okay. Peter, it's referenced recent events in the last week in Ireland where the Health Service Executive has been completely taken out by a cyber attack. You can pay your money, takes your choice as to which nation state has instigated it, but it has literally wiped out acute service, the whole lot. They have lost all access to all IT in all services. It's utterly catastrophic. It's still ongoing. Now, obviously, we rely on a lot of national systems for our work, such as NHS Mail, and we rely on external providers such as Lorenzo and System 1 to provide us with our systems. But I'm just wondering, what would your take in terms of on the audit committee, on the audit work that we've done so far in providing as much reasonable assurance as you possibly could do with regard to the state of play for us? Because obviously, if we became the subject of a dedicated attack, you know, it would be very difficult for us, as would it be for the NHS. And it's just sort of our understanding of where we are with regard to doing as much as we possibly can based on the work of what the audit committee has seen so far.
Thanks, John. I mean, we do take it extremely seriously. It is a standing audit agenda item to have a cyber security update. And if you remember last year, we had a cause sort of survey and work plan to work to, and we are monitoring progress against that cause work plan, and there are no red areas flagging. There's 1 or 2 amber in regards to training, but you know, we closely monitor that. I know that the IT department are very clear on what they need to do as regards updating the IT systems to ensure that unsupported software is quickly replaced with more modern and up-to-date systems. So you know, we get as much assurance as we can. Is it going to guarantee that we don't have issues with a security attack? I don't know what else we can do, but perhaps Pete can.
Yeah, I think. No, thanks for that, Peter. I've got Pete and then Michelle actually on this point. So Pete first.
Yeah, so I think it's a really good question, John. So as part of the internal audit programme, we do network penetration testing. So we did 2 tests this year. We did our general health social care network, and we got good assurance with only minor recommendations. And obviously we also did the recovery college, which did identify an issue, but that was rectified relatively quickly by the third party supplier for that website. So, you know, we've also got the data security protection toolkit. Obviously we monitor IG compliance. I think, you know, the danger is, so I use that word lightly, is human behaviour. So when we started the whole cause assessment process, now that's what I think was the biggest risk. It's people clicking through. Now we put firewalls up and everything, but I don't think any system's 100% safe. We do everything we can, but you know, and we invest in the network upgrade. So I don't know if that provides a level of assurance, and we will be testing again in June as part of the security protection toolkit assessment.
Thanks, Pete. Michelle?
Yeah, thanks. Just to reiterate really what Peter and Pete said, really, that obviously it's the audit committee get the assurance, but EMT get the reassurance. So we do get regular reports to EMT about cyber, and obviously we did have that detailed report, which we do take the updates to EMT and the action plan. But I just wanted to say I was actually going to mention this at some point, but just to say thank you to Pete and the team, because they actually acted quicker than I could respond back to them on the ransomware in Ireland by sending out the email to everybody to say that they'd done a lot of work and a lot of background work in relationship to what was happening in Ireland the day that it happened. So just to say thank you to Pete, to the team. I have said thanks to Richard Brumpton et al, but I think they did work really quickly on that. But we do, just to reassure the board, we do get some regular updates to EMT in relationship to the cyber report that we had, because if you remember, we did have a big time out on it as well. So we've not forgotten about it. That's still in train, even with the pandemic. So and obviously then the audit committee get the assurance. But I'll stop there, Chair. Thank you.
No, I think it's really useful, and it is a good question, John. And Francis as well, you're obviously on the audit committee, but you don't do the doing, but you're a non-exec lead for cyber, and I know that you regularly have conversations with the appropriate people to seek assurance about what's going on, don't you, Francis?
I do, and I've actually got a meeting upcoming with Pete opportunely in the next 10 days.
Perfect, thank you. John?
Yeah, no, thanks, Chair, for letting me put the question. The reason I wanted to put it, because it is vital, it is important, and we know staff watch this broadcast, as do patients, and making sure we're protecting them in terms of their data and the data security, because if we lose that confidence, we lose them. And particularly if our staff colleagues are watching, it's more about saying is, why do we always want you to do your IG training every year and get over the 95%? Well, actually, if you look what's happened in Ireland, that's the reason. And the other thing to understand is also for our colleagues is sometimes the firewalls can be a little bit frustrating as opposed to limitations on what you can use trust devices to access in the outside world. And that's one of the reasons behind that. So when you put the training together and you understand the firewalls, it's about IT trying to keep the show on the road as opposed to make your life a little bit more difficult. And perhaps, you know, based on the email I sent out, which was last Friday to all colleagues, which was really helpful, it's just about reiterating that to keep us safe as an organisation, actually we have to make some hard decisions, and that doesn't always make our life easy if we're doing a little bit of Google searching, but it's for good intent.
Thank you, John. I thought you were just trying to demonstrate why audit is real in terms of an audit committee as well, and just give it some real examples of what audit does as well. So just an added bonus to your question, John. So no, that's thank you. So is there anything else on that before we move on? No, so we've got a few people joining us for a couple of papers, and I know that we've got the annual, in between that we've got a couple of papers, including the annual committee effectiveness, which is quite a long document. So if board members are happy, I think we've got Alison and Alec with us for the Freedom to Speak Up Guardian annual report, which is item 15, and it's page 220 in your packs. So if you wouldn't mind if we could go to that first. So welcome, Alison and Alec. And Alec, I think it's your first time at the board, I think, isn't it? Hello?
Yes, it certainly is.
Lovely. Well, welcome to the board. Really good to see you here. And I know that you're going to be attending quite a few more of our meetings. There's quite a lot of us on the call, Alec. So I probably won't go around and introduce everyone, but if people could introduce themselves when they speak, I'm sure we'll meet you much more in an informal basis another time. But I'm Sharon, I'm the chair of the trust, so it's really good to have you here. And Alison, you're with us as well, aren't you?
Yes, I'm here, Sharon. Hopefully you can see me.
Yeah, good to see you as usual, Alison. Thank you very much for coming.
Thank you.
Michelle, would you like to introduce this?
I'll be very quick, Chair, but thank you. And thank you and welcome, Alex. It's great to see you here at the board, and obviously thanks, Alison, as well. This is just the annual, as Dean referred to in his report earlier on, this is the annual report from the Freedom to Speak Up. I'm the executive sponsor, something that we feel as a board very strongly about, and it just takes you through the work that we've done this year. Obviously, with the pandemic, we have continued our focus on freedom to speak up. It is very important, and we have, as a board, done the self-assessment process a couple of times. But I'm going to leave it there because the work and the credit for the actual services that we do go to Alison and the team. So I'll hand over to Alison and Alex. Thank you, Alison.
Thank you. Thanks, Michelle. And just to say that we did present this report at the Workforce Committee earlier in the week as well. So some of you will have heard what I've got to say twice, but I'll make no apologies for that, and you might have some more. You might have some more questions. So this is the annual Guardian's report. We thought it was important just to continue to raise the profile of Alec and Nikki, who were our earlier in the year were appointed as the two deputy Freedom to Speak Up Guardians, and Nikki came along with me to the Workforce Committee, and Alec is here today. So I thank them for their continued work, really, and I'll let Alec give you a little bit of feedback at the end. Just in terms of the report, which I'm sure members of the board will have read in detail, I thought it would be helpful just to give an update from the National Guardian's Office. They haven't yet published a report for this time period, but I thought it was interesting just to flag really the numbers of guardians that are now working across health sector providers, and the number of concerns that have been managed through the Speak Up route, with a particular emphasis on the increase that they've seen in 2019. And the largest staff group reporting concerns were nurses. During the year as well, they've also published 2 levels of training, the Speak Up Level 1, which is the core training for all staff, and the Listen Up for managers. We've been able to, the Speak Up Now is available, the level 1 in the training diary, and we now run this training course at every induction for new starters. It's a really good interactive session, and I think it's a great way of raising the profile of Speak Up with staff members from sort of day one when they come into the organisation. We've also continued during this period to report the numbers, the different types of staff groups, if staff have reported any detriment onto the national portal. So it gives us a really good opportunity to compare where we are with like similar sort of provider type trusts, but also with the similar numbers of staff. We remain an active member of the Regional Guardians Network and supporting the new chair. Just thought it would be helpful, as we usually do, to just share with the board the numbers of concerns that we've received in this 12-month period, which is significantly lower than compared to the 2 previous years. I think it's quite important just to draw the board's attention to the fact that if 10 members of staff contact the Speak Up Guardian about the same issue, this still gets recorded as 10 different contacts. And I do know that in sort of some of the previous years, we did have some larger groups of staff reporting concerns. I think also the fact that we've been in a pandemic may have affected the numbers. I think the introduction of the strategy and the change in culture of the staff and some of the results that we got back on the staff survey could also suggest as well that staff are feeling much more comfortable raising their concerns through their usual line management routes, and that staff are listened to and any concerns are taken seriously. Because of the low numbers, we haven't stopped our sort of raising the profile of the Guardian and Speak Up within the organisation. We've been able to do virtual dialing into Teams. We continue to sort of put our information within the newsletters. We put quite a lot of active communication in the COVID-19 newsletters, and I know that Michelle regularly puts in her blog around the importance of people being able to contact the Guardians if they want to speak up. Just there to share the sort of categories where the concerns have been raised. Usual sort of spread around patient safety and quality of care, patient pathways. We have had people contact us around concerns in relation to COVID-19 and working arrangements, which we've been able to escalate quickly. HR, bullying, harassment and grievances, which we have continued to develop that relationship with our colleagues in HR, where we're able to quickly signpost staff and take it out of the Speak Up process and put it into the process that it should be. Equality and diversity still is a concern for us, and we've got future actions that we want to continue to take to go back and check where we've had concerns raised with us, that the lessons have been learned and that staff are continuing to develop sort of their knowledge and experience from an equality and diversity perspective. Just to give the board a flavour of the areas where Speak Up concerns have been raised, there isn't anything particular that jumps out in terms of hotspots areas, but I thought it would be helpful to share that. And the range of staff reporting concerns to us. As usual, we had Speak Up Month during October, where we were able to raise the profile of speaking up and the Guardian role. Learning, as always, is a really important part of speaking up, and we've been able to work with our operational service colleagues to implement the learning where Speak Up, particularly in the particular areas where it's been raised, but also spreading that good practice across all of the teams. And during the period that this report covers, Michelle, in her role as Chief Exec and Executive Lead for Speak Up, has commissioned one independent investigation. Just to talk there a little bit about continuing to raise our awareness, how we're supporting staff. We do continue to, when we close to Speak Up, a letter goes from Michelle thanking the individual for raising their concerns. We do get low responses on the questionnaire, and this is something that we want to continue to look at going forward for next year. And then just to bring the board's attention to our work programme for next year, we continue to meet regularly with Michelle as the executive lead. We also have regular meetings with Sharon in her role as chair and Peter in his role as the independent non-executive senior independent director to be able to support the work of the Guardian. As Michelle confirmed as well, the board undertook this NHS self-assessment in March again, which I think just reinforces the board's commitment to speaking up and the role of the Guardian. That's the whistle-stop tour through the report. I'll stop there and I'll just ask Alec if he wants to sort of add anything or give anything about his experience in the last 12 months in his role as Deputy Guardian.
Yeah, thanks, Alison. Well, first of all, nice to meet everybody. I think I've probably met most people at various interventions over the last 3.5 years. I've been doing the role for it's coming up to a year now. Myself and Nikki are enjoying the role. It's quite a unique opportunity for ourselves to sort of make a difference on the freedom to speak up. From my personal point of view, it's quite reassuring from what I've seen from the cases I've had. Just how serious the trust acknowledges some of the issues that are coming to the table. And as you know, I've probably linked in with 3 or 4 of you on various occasions, and it's been a massive support in terms of understanding and sort of overcoming some of those issues. Just the other thing for me, just to reiterate what Alison said about just the continuation of us promoting our role and promoting our contact names and getting ourselves out there to be approachable for the colleagues in the trust.
Thanks, Alec. Thank you. And I didn't know if Peter wanted to add anything in his role as our...
Yeah, I was just going to come to Peter. Peter, is there anything you want to say as the guard in your role, special role?
Yeah, I can't really add anything, Sharon, except you know, I think the team are doing a great job. I think, you know, the comms part of it, you know, despite the fact that we've had so few, you know, only 24 compared to 50 of the previous year, but I can't see that we're doing anything different. I mean, in terms of comms. We're still at the October Speak Up month and everything else. Everybody knows, you know, who the Speak Up Guardians are. We've got more resource. So, you know, but I am assured the seriousness at which Alison and her team take each case and follow up, the way that the staff are treated when they raise something, the liaison, if you like, with the board as well, and the seriousness that yourself as chair and also Michelle take this, you know, important function. I think, you know, all the cultural aspects are completely there as far as I'm concerned, and it's another year of success for the team. So really well done.
Thank you, Peter, and I have to reiterate that, and I know Michelle does, but you know, you do really work very hard at this, and we catch up regularly, as you say, to make sure that things don't wait for annual reports. We discuss like how to promote, and I also know that, Alison, you've been to see join my meetings with the staff governors, and they're very engaged with the process and give you feedback, and it works both ways, doesn't it? And I know you're coming again soon, so that's really positive. I've got Francis got his hand up. John, do you want to ask a question you put in the chat box? Because I think it's a good question.
Yeah, thank you, Sharon. So it's Alison, in the absence of a national report, it's very difficult to kind of benchmark ourselves, and you know, the numbers go up and down, and the data is what the data is. What's your sense from you know, the Guardian network about what we're seeing compared to what they're seeing either at a local or a regional network, assuming that particular network exists? I'm not suggesting for a nanosecond that we do a deep dive into terms of how we benchmark, but in the absence of a national report, I'd just be interested into your feelings on this.
Thanks, John. And I think that there will be a national report. It's just our timing with our sort of reports, so we can have a look at that. If you look on the reconciliation on the National Guardian Office's portal, what has happened, I think, during COVID is that not all organisations have been submitting their data. So we haven't got as many to compare it to, but when you're looking at mental health, learning disability and sort of community type trusts, there has been, but you've got to think about the information for last year. There was an increase in reporting. Our numbers are quite low, but I would suggest that they're not. There's nothing significant in that, and in terms of the types of staff reporting, we're getting a spread as well. So from qualified, unqualified staff. I know that as the national report said, in the main it's nurses, but I think that's when you're looking at some of the acute trust data as well, where they've got predominantly really large nursing workforce as well. So I know that probably doesn't answer everything in terms of numbers, but I don't think we're a significant outlier.
Okay, thank you, Alison. Thanks, John, for that. Francis?
Thanks, Chair. And it kind of links to John's question in a way. I just wonder, and if we had the benchmarking data, it might support some of this, if the excellent work we talked about earlier on leadership, etc., that has been going on within the trust, and we link it to some of the feedback in the in the staff satisfaction survey, that people are finding it easier to work with their leaders and their managers, and therefore address these issues internally rather than having to resort to the freedom to speak up. And I just wonder if it's yet another indicator of how well that work is working and how it's benefiting the organisation. And if you had the benchmarking data, John, you might be able to then see if we were a better performer than other organisations. Don't know.
Yep, that's good. Well, I'm sure Alison will be reviewing it as soon as that data comes out. Michelle?
Yeah, thanks. The data was always a bit subjective anyway, even before the pandemic, because it was such a new area and people's database was different, but we weren't an outlier. So I think for me, it's that triangulation of what the staff survey is saying, what our recruitment and workforce statistics are saying as well. So because I think, Francis, there is an element of that as well involved. But my off the record conversations and data show that we're not an outlier, and actually, you know, we know that people are responding to it. We know that people are aware of the routes as well, and I think that's the most important thing for me. And what we're going to do during this year is just check and do more of a survey about are people aware of the freedom to speak up route, because that to me is just as important as getting the data through to say, well, actually we've had 20, somebody else has had 25 or whatever. For me, people need to be aware of the routes and be able to know how to contact their guardians is just as if not more important, and that's what we'll be also concentrating on this year.
Thank you, Michelle. Anything else? No. Well, thank you very much for the report and for the narrative that you've added to it as well. Really helpful and great to hear from you, Alec, as well at the board. So thank you very much for coming along. And I know, as Alison said, that we've discussed it. I know that Nikki, for example, attended the workforce committee, and I know that two of you will be attending the staff governor meeting with me soon. So it's very much a live interaction and really good process. But on behalf of the board, thank you to the three of you for all that you do, because you do work very hard at this, as Peter's right, and I know you take it really seriously. So thank you all. It's an annual report. We do appreciate it. And if you could pass our thanks on to Nikki as well for what she's done as well, we'd be very grateful. So thank you, take care, and we'll see you soon.
Thank you. Thanks, Alex.
Thank you. Nice to meet you all. See you later.
Bye. So board members, if you'll forgive me, I can see that we've got Andy and Victoria with us, who are here to deal with item 17, which is the Health Stars Strategy Annual Review, which is really good. Page 239 in your packs, if you just want to go to that. So welcome, Andy and Victoria. You've been waiting, so thank you very much. Lovely to hopefully see you in a minute in terms of, but welcome to the board.
Good morning, everybody. Thank you for having us.
Morning. Thank you. Lovely to see you both. And without further ado, I'll hand you over to, I think it's Mike Cook. Are you introducing this, Mike? You're on the agenda.
Of course, yes. I'll introduce Andy and Victoria. Welcome. I think Christina was going to join us, but so this is really building on the KPI report, the key performance indicators for how we're working with our friends and the Charitable Funds Committee, of course. So Health Stars are here to just talk about how they found last year, a different year, but a lot of activity that you'll hear about. We had a bit of a reset at Charitable Funds Committee yesterday, which I think was very helpful. And so let's continue that conversation. Welcome. Good to have you here.
Thanks, Mike. And we've had a sort of double act through the year with Pete and Steve as exec leads for this. So is there anything you two want to add just before we go to Victoria and to Andy?
Oh,
mate. Sorry, Steve.
So, go on, Pete.
I was just going to say, I think Mike's framed it really well, Steve, but I'll let you come in as well.
Yeah, likewise, and I don't want to steal Andy's thunder. I think there's some real positive things in there, so maybe might chip in after Andy's finished.
Thank you very much. Andy, over to you. You're on mute, Andy. There you go.
Yeah, the very polite thing to say Victoria first, if that's all right.
Thanks. Yeah, just thank you so much for receiving the report and reading it. We just wanted to highlight the people changes we've had in year. We've had Jude come on board with us for the Whitby appeal, which has been great, and we've been really pleased to get that launched in year and start the fundraising. We've also had Bibhash join us, who is our Black, Asian, minority ethnic wellbeing project lead, and that's had a really good start to the work that's been happening with that. As you're all aware, a big chunk of what we did this year was in the food hampers, and that's where we spent the majority of our money on providing staff with food hampers at critical times during the pandemic. So that was just a few bits that I wanted to pick out, but I'll let Andy go next.
Thank you. So I think from my perspective as leading this piece of work, I think we've seen some real development within our people, even though through a challenging, difficult period with COVID. Christina, as a lot of you have come into contact with, has done an excellent job on the ground, connected in with the groups and helping to deliver, obviously, the food hampers and connecting with our volunteer services as well, and maximising that partnership approach with regards to supporting our staff and our teams across the patch through that period of time. And being able to procure that food was a difficult thing in itself. As some of you may be aware, food was very difficult to get hold of at certain times within the year, and we wanted to make sure that those refreshments was available and distributed. I think from my perspective, having the element of Smile and our proactive approach enabled us to secure more funds from NHS charities together. We was one fund in particular which didn't look like it was suitable for Community Mental Health Trust, but we was able to make the most of the loophole that was there with our proactivity and make sure we got that resources back into the charity as well. So maximise the funding availability for ourselves, focused on our people, as you saw within the spend, but equally didn't let our rest on our laurels with regards to developing the Whitby project and supporting a fantastic activity that's going out in Whitby with our colleagues in Whitby, engaging with the public in that as well, as much as it brings some challenges sometimes. And we need to make sure that we're open and transparent and bringing in our partners from the voluntary sector within the area, which has been great to see. Finalising some of the elements of the impact appeal and supporting our colleagues with the Inspire building, and we continue to invest into that space. And equally, as you'd have seen within the financial reports that come to the board, challenging ourselves to spend the money that we do have, because the best way to fundraise is to actually spend the money that we've got and regenerate that money coming back in. So really positive financial report, although we slightly missed our target, but only slightly. As you'll see, we finished with a higher balance than we would like to have done, which is a challenge for us to make sure we keep on spending. And we're delighted to have Claire Jenkinson joined us at the last meeting to start to look at stimulating some activity in Driffield and Bridlington and so on, where you can see some high balances. And one of the other challenges for us on us to bring forward to these meetings as well is to start to bring this to life. I think we previously, with my enthusiasm and passion, it was probably too enthusiastic and too passionate and not enough of the detail. I think we've got a lot of the detail now, and we just want to bring back some of that enthusiasm and passion in how we display our annual report and some of our activities, some great visual things that we can bring to this board and some great case studies of how we've impacted on our staff and on our patients.
Thank you very much, Andy. Right, so we'll move to questions or comments, if that's all right. Anybody got any questions or comments? Obviously, we had the paper last month as well, didn't we, with your KPIs looking forward, so that's really good. Michelle?
Yeah, no, it was a good conversation. We had a lot of conversation yesterday at the charitable funds, as Mark said. We did a bit of a reset, so I just think it's, it was a good conversation. It's a good report, lots of positivity. It's useful to know, and I quite like Mike's comment about not a loophole but an opportunity. And it's good that we're seeing more smiles and wishes being requested and granted. So I'll leave it there, but thank you.
Thank you. And can I say from my point of view, I mean, I saw firsthand the impact that what you did for the staff, helped with what you did for the staff in the, in the midst of the pandemic when it first got started and everything, made such a difference to people. It really did. And it wasn't easy to do. So, and as I said, I did spend one day packing hampers with Christina. And as I said at the time, they weren't hampers at all. They were just vans full of things to support staff in a really, really stressful and challenging environment. So, it has been a difficult year, but I think you've done some really great stuff, and looking forward, it's looking very bright. So thank you on behalf of the board for everything you've done. It really made a difference, and thank Christina for us as well. And I suppose I'd also like to take the opportunity to thank the Charitable Funds Committee as well, because we are the corporate trustee, and the board members are all invested in this. And I think as a committee under Mike's chair and working with you all and the exec leads, I think the future is looking very positive, and I think we've got an exciting year ahead. So thank you all for everything you've done, and it's great to see the report here. So thank you for coming.
Thank you, our pleasure. Thank you very much.
And we'll see you soon.
See you soon.
Okay, so if we could please move, and then we should be straight on the agenda now. So if we can move to item 13, which is the Commissioning Committee report. Peter, and this is at page 102 for anybody who wants to get it. Give you a minute, Peter, and then if you could just
it's all right, Sharon. I think
introduce it. Thank you.
I haven't got it in front of me, but I think I know what went on anyway. I think the work stream updates that we get are working really well. And this committee was only one day after the last board meeting. So at that board meeting, we had a separate session on the partnership agreement. So I think the board members are quite well up to date with the partnership agreement and the what's in there and what still needs to be done. And as I sit here today, I know we've done more work in workshops on the risk and gain share, but we've not seen a final partnership agreement or anything that's sort of near completion as regards, say, Schedule 4, which is the financial arrangement. So there's still quite a bit of work to do on that, and obviously as a committee, we will on the board we will chase that and get it to as completion as much as possible, so that we know what we're entering into before the 1st of July. And then the other issue, of course, is the financial due diligence, which has still got a gap, as we've noted before.
Thank you very much, Peter. Is there anything anybody wants to add? Pete?
Sorry, Sharon, I was on mute. Nothing further to add, other than myself and Michelle are trying to get a call with the national team when Michelle gets back from holiday.
Perfect, thank you. I know we've got an item on part 2, so that's good. So any questions on this? No, thank you very much for that report. So if we could move on to then item 14, which is the annual committee effectiveness reviews and terms of reference. And obviously we need to go through these in turn, if that's all right, because we need to approve each terms of reference as we go. So Michelle Hughes, thank you in advance, because you've done an awful lot of work on this, and thank you to all the committee chairs and all the committees for the time putting into this. It is important that we do this once a year, but I really do realise it's a lot of work, hence the 113 pages that is this report. So thank you, Michelle, for what you've done, and over to you.
Thank you, Chair. So this composite report provides committee effectiveness reviews of each subcommittee that reports to the board and looks back over the past year. Each committee has prepared their own, and they have their own terms of reference. In a moment, each committee chair will present their own and, as you say, terms of reference for review, but just a couple of areas to note first, please. So the Charitable Funds Committee review was prepared back in March, but it was only taken back to the meeting yesterday. Following feedback from the meeting, there's just a slight update before it's presented. There were actually 6 meetings planned in year, but only 5 held, as the May meeting, as it says on the report, was cancelled due to COVID. So that affects the corresponding choracy. So just to be clear, all 5 meetings were quorate and each had 2 non-execs present. Also, the registered charity number needs inserting, which for information is 1052727. The committee work plans, as last year, Audit Committee have requested these to seek assurance and triangulate with the BAF so that the committee can demonstrate awareness of the work of other committees. And these are being collated for the June audit committee meetings. So if I can stop and hand over to committee chairs to present each appendix. Chair, please.
Thank you. I'll take them in the order that they come, if that's okay. So I think we start with the Quality Committee, Mike.
Thanks very much. I would just like to make 3 sets of comments, Mayor. One about the 2 committees I help with, but also about governance, because I've been thinking a lot about governance over the last few days. This is quite a governance and performance agenda for us today. My tests, I think, on governance are: is it sound? Is it strong? Is it sustainable? Is it strategic enough? And I think the Quality Committee really meets that standard. I'm really proud of where we've come from and where we're still going, particularly in this last year that we've had. And you see that from the report. But I'd also like to commend, if there was an award for Committee Improvement of the Year, I think the Workforce and OD Committee's been really fantastic, where it's come from to where it's got to, and also the audit with the engagement of 2 new auditors. I think it's really strengthened us. So just to say that, and all the other committee progress that's going on. So I think we're good at governance. I think we just need to keep it proportionate now, and I think we need to watch the commissioning committee, particularly in that sense. And use our expertise to transfer those skills. So that's the first area. The second area is the Quality Committee. I think it's done 3 things. The business as usual stuff is really important, as we're demonstrating today, and it continues to develop. The COVID response has been very proactive, and I think that's been a real defining feature of Humber during this last year, and it wouldn't have been as defining if we hadn't done all the sort of real heavy lifting around quality with QPAS and everything. And I think we still do quality improvement all the time, and including the board. We are interested in quality improvement. It's become a bit of a reputation that we have. I would like to thank Hilary, John, and Lynn in particular for how they've worked together during this last year. I think it's really come on, and the deployment through that approach is much stronger and more consistent. So thank you to everybody, and to Sue, who does a great job in supporting us. So that's point 1 on the committee reports. And I don't know if John or Hilary wanted to add anything, but it's been a good year and a heavy year for the Quality Committee, but I think we're still in shape and ready for more, aren't we, Hilary and John?
Thanks, Mike. Hilary and John?
Yeah, bring it on, Mike. Yeah, I mean, I think the committee's really got its rhythm now, and we look at things, particularly on the quality improvement agenda as well, in more depth. It gives us that opportunity to have that discussion about what we're doing, where we're going with stuff, and that confirm and challenge, which is always helpful as we move forward with the quality agenda.
Thanks, Hilary. John? Nodding?
Just nodding, but just to echo, Mike, your point about the ability to look out and then think about the outside world, and then think about how we might bring that back in, is the one thing we're doing now. We have the time to do that now, where perhaps 2 or 3 years ago we weren't quite in that situation as we did an inward focus. I agree, you need to do both.
Thank you.
Okay, well, thank you all very much. Mike, is there anything you want to add before I go to the terms of reference?
No, I think we've got the right ones, so they're there. Yeah.
Okay, well, thank you all. You've all worked extremely hard over the last year in an extraordinary year. So, and as Mike said, I've attended the Quality Committee, so I've seen myself the size and range of agenda, but how it flows as well. So, yeah, it's doing a good job. So thank you all very much. So we're asked to approve the terms of reference for the Quality Committee. Are we happy to do that? Any dissensions? No. Okay, Jess, we've approved those. So then if we could, I think we stay with, I might be staying with you, Mike. We are charitable funds committee.
Thank you. The headline for charitable funds committees, it's still work in progress, and I think it's we had a bit of a reset, and I think that's going to really help us going into this next year. We have been quorate, and I think we've seen some real progress in the connectivity of the charity with us. The NHS Charities Together grants have been great to have and have been deployed quickly and with relevance to patient, staff, and keeping people safe, the public too. Getting Whitby going now is important. I think we've ironed out some of the wrinkles there, and that's now an appeal. My view is that we work best with Smile when we've got an appeal going, as well as the grants, etc. And we also have looked back at just, did we do what we said we'd do on the tin on Inspire, the child and adolescent mental health unit. So I think there's more to do, but I think perhaps the on-the-ground response with the sort of, we said in the last item, that was really good. Over a very difficult time, very stressful time, and I think everybody went the extra mile, and that's great to see. So thanks to Steve for coming in and taking the exec lead. We now want some consistency, I think, with the exec input. Really pleased to see the wishes reconnect with staff and patients, and we need to keep that now so that we can push on to the next level. So I think it's a specific committee, but it's still our weakest one, and we need to keep working on it, I think would be my take on it. And I think you probably get a sense of that from the report. Steve, if I may, we did just tweak the terms of reference yesterday, and I haven't said do an assurance report overnight because I don't think it's fair to ask that. So it'll come next time, and that was my decision as committee chair.
Stephen, you want to add?
No, we just had a conversation in the committee about the composition, wasn't it, Mike, of the group, I think, and formalising the arrangement maybe with Claire Jenkinson, and just be clear about what my role as the exec lead was within that.
Okay, thank you. So are you suggesting any immediate change to the terms of reference that are here before us, Steve?
I think, Mike, we agreed for that for Claire to be a member of the group, didn't we?
Subject to Lynn's take on it. Yeah. So that was the proposition, so that we've got more operational staff input, which I think would be welcomed, and okay. I think Claire felt that too.
Michelle.
Yeah, sorry. I mean, I was at the meeting yesterday, but I'm not sure we totally agreed that, because I think and as Mike said rightly, we do need to check that out, because I'm not sure that Claire can be a full member because she's not a trustee, but she is going to be in attendance regularly. There's a few, but I think we just need, if we can just clarify that. I think we did say we needed to clarify
so
it.
If we can have scope to clarify that, we will do, and it's work in progress. The terms of reference have been significantly revised, so they are now in line, I think, with most of the others. And Michelle, thank you for the help on that.
No, that's great. So thank you very much. That's really helpful. So we're asked to approve what's here in front of us on the board papers at the moment, and obviously it'll be work in progress, as has been pointed out. So are we happy to do that? Approve the terms of reference? Any dissensions? No. Thank you very much for those reports.
Thank you. That completes the votes from Hillam. Thank you.
It does. Moving on to the Finance and Investment Committee, Francis.
Thanks, Chair. I'd echo Mike's comments about governance and the way everything is structured. Top line from me, the quality of the papers has improved over the year. So we've got really good papers. We've got very good constructive challenge within the meeting. We deal with a lot more in the committee, which I think frees up board time for other things, which I think is the right thing to do. Hopefully the reports give good assurance. I'd like to thank Pete and Ian for all the work that they've done. It's really developed over the last 12 months. We've now got a regular presentation from John Duckles, which is excellent. We undertook an internal review, which all the members took part in, which is attached. and I think you can see the effect it's had in terms of the financial performance we've had over the last 12 months. I'll keep it short and sharp and just see if Pete wants to add anything.
Pete?
Thanks, Francis. So, yeah, I think that's a good summary. I think it's been a good year. It's been an unusual year, you know, in the way finance has been governed in the NHS. But, you know, I think we've maintained our financial governance. I think one real achievement for me for the year was the improvement in the primary care position and the oversight of that for the Finance and Investment Committee and maintaining that focus, which, given we have been in a pandemic for the last however many months, was a real achievement.
Thank you very much. Okay, are there any comments or questions? Yes, Pete, you've got your hand up.
Just one, Sharon. I've noticed in the terms of reference it stays bi-monthly, but I understand that all committees are moving to quarterly. Is that correct?
Is that correct, Francis?
I hadn't picked up that we were moving to quarterly, I must admit.
I did think we'd had a conversation that we were, but maybe we just take it offline, Sharon.
I was going to say I'd not picked up that we were moving to quarterly yet, so
let's take it offline.
Yeah. Okay, well, let's take it outside. So for the time being, we're asked to approve what's in front of us, the terms of reference. Are we happy to do so? Yes. Any dissensions? No. Okay, thank you. If we can move on to the next one then, which is sorry, I'm going through all your reports, Francis. The Mental Health Legislation Committee, Mike Smith. Mike, are you on mute? Mike Smith? Okay, John, do you just want to start this?
Internet went down, Sharon. Can you hear me now?
We can now, yes, thanks, Mike.
Put it on the iPhone. If we've got two mental health legislation committees, a couple of things that I wanted to highlight, if that's okay. And that's the first one is about EDI. And there's a comprehensive minute extract in there about the work that we've undertaken in trying to work out the important issue of whether people are judged fairly in terms of the Mental Health Act, and an issue in splitting out the whites population, and particularly in terms of Eastern Europeans. So that's the first one. The other ones I think were addressed when I just spoke about the assurance report, but there's other one for which I apologise, and that's that the team weren't able to contact me about the forward work plan. So the work plan element in section 9 is a carryover from last year. I think John and Lynn and I can either discuss that outside the meeting or come back to that at Mental Health Ledge, but that forward work plan does need updating.
That's fine. John, anything to add?
No, thank you. Just to say, I think it captures the work that's been done today quite fairly. It acknowledges the work, and I think we're in a stronger position this year compared to last year, particularly because the steering group, Mike, is up and running, and that's been the underlying concern for us collectively, that absence of that teamwork down below, and that has now been addressed through Michelle and Kwame, and actually that'll do an awful lot of the doing and provide us with that assurance that we need as a committee. And then perhaps in the same way that Quality Committee and others are looking out, allows us to look out and think about wider subjects such as the CQC work, particularly around closed cultures. That's really positive from my point of view.
That's great. Thank you very much. Any questions, comments?
Thanks,
Hillary?
I'm going to dip out now and come back on the ordinary computer, if that's okay.
That's fine. Thanks, Mike. Hillary?
Just a minor point on the terms of reference for the committee. Are we on that now?
We can be, Hillary. Yeah. We can be.
Just around the membership, you've got Assistant Director of Nursing Operations in there. Since the restructure of the divisions, that post is no longer around, so obviously would need to be removed from the membership.
Can we take your advice on whether there's a replacement needed, or are we okay to just delete that, Hillary?
Can I pick that up with Lynn outside the meeting?
Yeah, please. Thank you.
Okay, so we'll delete that for now, but can we please just you can take it back to the mental health legislation as to whether you need to add somebody else in, whether it's felt necessary. So on that basis, with that one deletion, are we happy to approve the terms of reference? Yes. Any dissensions? No. Okay, thank you very much. So we'll move on to the Audit Committee. Peter?
Thanks very much, Sharon. I think we had quite a good discussion a bit earlier when I did my assurance report on the effectiveness of the audit committee. So we've got the report there. It worked really well in the year, despite being everything was online. All the audit reports was really great quality. We had a seamless transfer to Audit Yorkshire, as I said before. We've picked up the work about a year ago from the Information Governance Group, and we'll get their effectiveness review at our August meeting. So we've not had that yet, but that is in the pipeline, and I'm sure if it's anything like their annual report that came through in November, then I'm sure that will be seen as an effective committee or subcommittee. But I think we'll get that formally in August, so it's not here now. And I think that the other thing I'd just like to say that I perhaps should have mentioned before, there is a draft internal audit report on the board assurance framework, and that is showing a high degree of assurance. So at the very top, degree of assurance on the board assurance framework. So I think that bodes well for the way that committee structures and the assurance that the board gets on a variety of risk areas, if you like, and things that we need to get assurance about is working really well. So I think we should take comfort from that, even though we've not had it formally to the audit committee yet.
Thank you very much, Peter. Pete?
Couple of minor changes on the terms of reference. One is just a typo, and the other is just change the schematic to include the commissioning committee.
Okay, thank you, Peter. Pete, is there anything you want to add?
Nothing to add, Sharon. I think Peter's covered it really well with that and the conversation earlier.
That's great. Thank you. Any questions on this one? No, thank you. Really positive. Yeah. So we're asked to approve the terms of reference here. We're happy to do so. Yes. Any dissensions? No. Okay. Duly approved. If we can move on to last but not least, and in Mike Cook's Oscar winning, the Workforce Committee for the most improved. Dean.
Thanks. Thanks very much. Yeah, this is the newest of our committees. So first of all, thank you to Francis, who did the legwork in setting it up before handing over the chair to me last year. Since then, what we've tried to do is, given the assurance that we got through getting a lot of data and understanding what was going on in the organisation, is to move the papers to a more strategic, forward-looking agenda. And we've done a sort of cull of some of the information that used to come to the committee. But taking the opportunity to deep dive where we think we need to deep dive and get more information as and when we need it to seek assurance. I guess one of the dangers around a workforce committee is that workforce can just be seen as the sort of responsibility of the HR director. And I think with this committee, that's not the case. So in addition to thanking Steve, I'd also like to thank John and Lynn and Hilary, who regularly attend. And you do get a real sense that they take this issue just as seriously, recognising that if we get it right for people, we'll get it right for patients, which is what key sort of focus is on that. And then the other thing I suppose is just commenting on. I'm also a member of the Quality Committee and the Mental Health Legislation Committee, and I think what we've tried to do here is bring the same tone across. So that these feel very open, professional discussions where people are open to challenge and discussing around our sort of expertise in these areas to get the right sorts of decisions. And it feels very sort of constructive in that regard. These aren't defensive, or trying to sort of showboat information, but people generally grappling with how do we get it right. And I'd like to think that that's followed through into the Workforce Committee as well. So thanks for the steer from both Mike and Mike. On that, but again, happy to take any questions.
Thank you, Dean. Steve, is there anything you want to
add? No, nothing really to add. Sharon, thank you.
Thank you very much. Any questions or comments on this one? No. Are we happy to approve the terms of reference? Any dissensions? No. Okay, that's great. Thank you. And then if I've got it in the right order, the next one is the Remuneration Committee. It's there, it's brief. The board have had regular reports through the year about what's been happening there. Very good attendance from the non-execs, and now support from Steve and Michelle. And I'll just really go to questions if that's okay. Any questions or comments? No. Are we happy to approve the terms of reference? The changes are detailed there. Any dissensions? No, thank you very much. And then last but not least, if I get there, it should be the board, I think. Yep, so you all had obviously the opportunity to input into this. Thanks to Mike Cook and to others for their comments, which hopefully have been incorporated into this. From my perspective, it's been although it has been an extraordinary year, it's been a really strong year for the board. I think the board adapted well, and I thank you all for that, to the changes. So we went virtually immediately. Extra briefings were introduced. The subcommittees hardly missed a beat and just adapted to the change and carried on doing what they do best. And I think the interaction between the subcommittees and the board and the subcommittees with each other has remained strong and grown throughout the year. And I think that's a real achievement in the circumstance we find ourselves, to be honest. And I've attended at some point, at least once, all the subcommittees, and I've seen the direct link and the referrals between them. And I think it's also, I just want to acknowledge the desire to improve all the time. So it sounds, we're not just sticking with the governance thinking it's sound, we're looking at how we can improve. And John's right, and others, that we should be pushing ourselves to look out. But I think you can see the changes, whether it's introducing, making live the risk register and the BAF for each committee, whether it's now talking about internal audit, taking it to each committee as to what they want to look at, how they want to help improve. There's a real desire to constantly not rest on our laurels and get better. So I suppose I just want to take my opportunity to say thank you to all of you as board members. It is a review of the board. You've all worked extremely hard over the last year, and particularly the exec team in what was just unknown circumstances. But to keep the board, the subcommittees, the governance, keep the organisation safe, but achieve all the other things that have been achieved in the area is remarkable. So my thanks to all of you. I think it's been a really successful year for the board. And hopefully some of that comes across in the review. So just happy to take any questions or comments. No? I would also just like to thank Jenny Jones. I know she's not here today, but Jenny works tirelessly behind the scenes and spends an awful lot of time pulling this all together and working with you all to put together the agendas, the papers, the minutes. And that doesn't even touch what Jenny does. She does an awful lot behind the scenes. So on behalf of the board, I'd like to thank Jenny Jones for everything that she's done. It would be very difficult if she wasn't in that role. So thanks to Jenny. So are we happy to approve the terms of reference? Any dissensions? No? Great, thank you very much. So I think that completes that paper. Michelle Hughes, unless you need to prompt me to do anything else.
No, thank you, Chair.
So if
Michelle's got a hand up.
Oh, sorry, Michelle.
Yeah, no, I just want to say something, because I do dip in and out of all the committees throughout the year, and you can see the evolution of the committees, and I agree with Matt, we've got to get that balance between the strategic, the governance, the internal and the external, and I think they really are shaping up like that, but you can just see the development, and that's due to the hard work of the NEDs and the execs who are working really closely as a team, and it is really sustainable and positive. So I just want to say thank you to everybody involved in that already, because I can see the difference when I go around them all and what have you, and especially during the pandemic as well. And they've schemed down, they've schemed up in relationship to the changing landscape of the pandemic over the last 14 months. I thank everybody for that and their commitment and their passion in their areas that they're responsible for. I mean, I do think that comes out really well. It's also good to see that and that passion, but it will also be really helpful because in my report earlier on, I did mention, and I waited for this part to flag it, that we do need to do an external governance review under our terms of licence for being a foundation trust. And we've rightly, as I say, extended that as much as we can. So we do need to do that in May 22. So there may be 100 odd pages, but it'll be really, really helpful for that governance review, and hopefully it will reduce the amount of work we need to do at that point. So thank you in advance for that, and that will start towards the end of the year. But I just want to leave it there, Chair, so thank you.
No, that's helpful, Michelle, to bring in the link. Yes, you're right, it was in your report earlier, so we've discussed it as a board before, but I think it'll be a good time to do it actually, and as I say, always looking to improve, but thank you all again for what you've done this year. So if we move on please to item, I think we're up to item 16, which is page 226, the annual declarations report. Pete, and obviously it's already been in draft form once.
Thank you, Chair. So this is the updated declaration report that hopefully we're all now familiar with. Just a point of correction, the dates in section 2.1 are incorrect. This came to board in January and did go to Council for Governors in April. I have had one email from the chair which suggests we can strengthen the evidence in condition G7 to reflect the recent CQC desktop exercise, so we can update the appendix to reflect that. I think that, you know, this has evolved over a number of years and there's quite a lot of evidence in there to support us making the declarations we make. I mean, I think I'll stop there, Chair, and I'm happy to take any questions.
Thanks, Pete. Any questions on this? No. Okay, we are asked to approve it. So with the addition as Pete's described, and he's already mentioned, I just picked up that the dates we've done it more currently than that as he's described. Are we happy to approve it? Yes, thank you very much. Thanks for that, Pete. Okay, if we could please move on to the last item, which is item 18, the Humber Coast and Vale Annual Report. Michelle.
Yes, Chair, it's just there for information, but I thought it was important just to have it as a standalone item. So it's there just for the board as awareness. It does go through a little bit more about the developing ICS, but also their progress in relationship to their 4 key priorities, which are staying well, providing services that are joined up across the patch, improving care across the ICS and making most of our resources, and the rest is self-explanatory. So I'll try and answer any questions, Chair, but I'll leave it there.
Thank you, Michelle. There's quite a lot in there. Mike Cook.
Hello. Good strategic item, this one. I just wanted to say I think it's been great to see us being proactive in this space, in the system, the way it's evolving, and well done to Michelle and the team for that. And if you look at the mental health and leadership and learning disability provider collaborative, just to start, and that partnership's sort of 3 years old now, and you know, the second conference was fantastic, you know, with Steve Neames opening it and National Czars and other people coming to support it. Also on the children's, also on the learning disabilities, also on LICRA. Let's get LICRA in there, John Byrne. And I think the immunisation and vaccination response wasn't just for us, it was for the system. And I have to commend you all at a busy time. And it's interesting now because we've got psychology leads and AHP leads wanting to understand system thinking as well as organisational thinking. That's a really healthy sign. What I think we should do with this annual report, because I think it's the best thing that HCV have produced so far, is to bring it into a board development session and say, well, against those 4 things, are we aligned enough? And, you know, what can we contribute further? We're already contributing a lot, but without overheating us, you know, what should we be doing strategically? And I think that would be really helpful, Michelle. So thanks for bringing it here, and happy to talk later about it, because I know you've got some other stuff later on. But well done for the influence and the position we've got to. You know, how do we take it for a spin, I suppose?
Yeah, thanks for some useful comments there. We are doing the board development session on strategy, and I've asked Stephen to come along as well to that. So it'd be really useful maybe to do exactly what you've said. So we'll have a conversation before that session, Mike, and that will be really helpful. But yeah, we can use that. And actually, it was quite interesting because they used the annual report that the Mental Health and Learning Disability Collaborative have been doing for the last couple of years as a template. So that was quite good, as they are with a lot of the things in the provider collaborative. And we're having another international conference later on in the year. The date's been published, but I'll send the date out to people.
Thanks very much, Michelle. Thanks for the suggestion, Mike. Anything else from anybody else? No, thank you. Well, if we move on to item 19, the items for escalation. I'm not aware of any, unless anybody's got any. No, any other business? I'm not aware of any. No, well, thank you all very much. I think it's been a good meeting. So if we could close then the meeting in public. Adam, thank you all to everybody who's contributed, and also to anybody who's joined us virtually. Thank you very much for your interest in our board meeting. So we'll now close this meeting and then we'll move into part 2. Adam, if you could just confirm when the live streaming stopped, please. Thank you.